Ladies and gentlemen and anteater, prepare yourself for tonight's festivities, which fashionably late will still be fashionably awesome. Please find a seat. Judges, find your spots. Tammy Kim in the house. Say hi, Tammy. We've got representatives from our government. We've got people who are influencers here on campus. We've got students, we've got staff, we've got faculty, we've got an anteater. Ladies and gentlemen, take a big deep breath together. In and out, and smile. You see, when I did yoga this morning in Vegas, because that's where I was, just flew back from CES, my intention today was to stay calm and collected. And that's not normally my mode, because I'm pretty high energy. So calm and collected got me to here, and then it's time to spark it up a little bit and get things fired up. Now, welcome to the AI Innovation Challenge Final! I'd like to thank our sponsors. There's too many to name. What a bad problem to have. Put your hands together for the people who put up this $50,000+ in cash for our sponsors. Each clap is worth at least $100. Keep it going. 30,000, a little more. 40,000, a little more. 50,000. Okay, stop. That's enough money for today. But sponsors, you see that energy? You give us money and it turns into claps. We also have judges. Now, judges, would you please just rise and turn around, and we'll do a bow, a courteous bow, and as soon as they're done with the bow, you will give them a round of applause. Ladies and gentlemen, all judges here are fair, they are impartial, they are business experts in their own right, and they are doing their best to find the winners of today. But I will tell you, some of you will win and some of you will lose, but the future is up to you. Today is just a step in that journey, and we got you the whole way. Ladies and gentlemen, to your judges, judges bow, and everyone else give them a clap. All right. Now I'd like to ask Stuart to come up here from Be Applied Innovation, as he is a sponsor and a judge, and I'd like him to say a few words. So I know you might be clapped out, but we have a long night, so just give a golf clap right now. We don't want to get you too crazy. Golf clap.
All right. Is it working? Here we go. Thanks, Alex. Hey, welcome to Beal Applied Innovation. Not sure how many of you have been here. I'm not going to do a show of hands. I'll bet not a lot. This place is incredible. I work here. I'm part of the Enterprise Collaborations Group. I report to the Chief Innovation Officer, who works closely with the leaders of this campus. For what? To take innovation, ideas, intellectual property, turn it into products, turn it into revenue, stimulate the economy, and turn out some really smart people like we're going to meet today in this room. We are passionate about founders and entrepreneurs, and myself, honestly, was one. And I got to tell you, you guys have it made. So many tools. You're going to show us even more today. We're excited to see what you have. Our focus is around an area called generative AI with respect to narrative, and a project that we're running that is all about the use of story in all things that we do, right? If you think about faith or politics or movies or books, entertainment, gaming, etc., we are focused on that space, right? And for the good of it, everything from the humanities side of it to the science and the computer science. So we're really interested to see how you're going to tickle our brains here, show us the products that are going to change the world. So congratulations to you all. Welcome to Beal Applied Innovation. Thanks.
Thank you, Stuart. Thank you, judges. Now, I want you all to understand that the judges are judging based on a rubric. And if you look at this, it's about a problem that's defined, the innovation, feasibility, impact potential, their presentation quality, which is a big one because we're here in these bright lights, as well as the team capabilities. All right, now they will be judging on a rubric, but at the end of the day, when they deliberate, it's going to be the collective group that makes these decisions and the winners. Now, we have AI and health impact, and before we have those teams pitch, we have a very special panel, but I'm not there yet. We also have AI and storytelling and entertainment, and in student experience. And what we're going to do is we are going to start with our panel. Because why not hear from industry experts and then hear from students who are creating, and we can see, wow, is this really connecting the dots, which it really is. So if I can please get my panelists up here, let's get a round of applause for Colleen, Terry, Tom, Sean, and Saskia. Come on up. Come on up, let's get chairs. Can we get pink volume, please?
Test, test, test. Okay. Just one correction. It said up there I was Dean of the School of Medicine. I am not Dean of the School of Medicine. Just.
Alex, can we go back to the judges, please? All right, so take a seat. And there's one guest who we have not. Alex, can you help us to get this to the, won't seem to go backwards. To the judges, please. We'll get you a microphone there. I'll bring a few more up.
I think the.
Okay. Oh, am I up here? Maybe I'll just take the chair with me. All right, you're the moderator. Please sit down. Hold on a second. There's one very obvious person who we have not acknowledged, and this person is going to be the person to kick us all off. So, ladies and gentlemen, the one, the only, it's a dangerous zone there. Put your hands together. Peter the Anteater! Come on, Peter, let's come it down. High five the judges as they go around. You can't stop clapping until Peter's in town. Let's go. Peter, 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 Peter. All right, Peter, are we allowed to start? You think we should do a Zot, Zot, Zot? All right, if you don't know it, put your hands together like this, your thumb drawn back, your anteater ears up. On the count of three, the largest Zot, Zot, Zot. Then it hands over to Terry. We're going to start the show on the count of three. 1, 2, 3. Zot, Zot, Zot. Terry, take it away.
All right. Well, thank you for that introduction. It's like a hard act to follow. You know, I think just so people know who we are, I'm Terry Sanger. I'm the Chief Science Officer.
We all saw the thing. This is real, but ready? And action.
I'm not sure. Are we back on? Okay. Yeah. As a professor of mine once said, lower the gain or increase the phase margin. So anyway, I'm Terry Sanger. I'm the Chief Science Officer at Children's Orange County, and we'll be moderating this.
I'm Colleen Cunningham. I'm Chair of Pediatrics at UCI, Pediatrician in Chief at CHOC, and I'm a pediatric HIV researcher.
I'm Sean Young, a professor of emergency medicine and informatics here.
Tom Andriola, Chief Digital Officer at UC Irvine and a former health tech executive.
And I'm Shaista Malik. I'm the Associate Vice Chancellor for Integrative Health and the Executive Director of the Susan Samueli Integrative Health Institute, and I'm cardiologist by training.
And thank you all for being here, and thank you all for being here. And I really want to thank the student groups who are going to present us with some really, truly spectacular work. But to be controversial about this, this is all about AI in medicine. And I think really the first question I want to ask the panel is what's wrong with using AI in medicine? In other words, where do we expect this not to work? And maybe thinking a little bit about where the permanent holes are, the things that may never work. There may never be an application for AI in certain areas of medicine. Or there are areas where there's potential applications, but we don't yet know how to do it. So I'm going to sort of pass that hot potato down the line here and see what you all think about that.
You hear me? Okay. I can start with just one problem. I can think of probably 10 problems with AI, but one of them with AI in health, if something's built entirely by engineers or computer scientists, statisticians, without the involvement of the clinician, without the involvement of the patient. There can often be the belief that the machine itself is all that's needed and can change healthcare. And I think healthcare is fundamentally about people. And there always needs to be, I think there always will be, AI is going to continue to advance, but we always need clinicians and patients involved in using it together collaboratively.
So I think I'll answer this question through actually a real story. I happened to be at an AI in healthcare event last Sunday and got to hear from many healthcare organizations from across the country talk about these topics. And there was a set of institutions that worked together to basically see if they could use generative AI to generate patient responses. So after a patient visit, the patient summary, going back to the patient through email, they tried to use the tools. And it was very interesting what they learned, because we learned a lot, and I think that's that's the stage we're in right now. The first thing was that the doctor typically would write 3 or 4 sentences, the human would write 3 or 4 sentences, generative AI wrote 3 to 4 paragraphs. The doctor typically wrote in language that's comfortable for them, a lot of medical language that's hard for a layperson to understand. The AI used more general English because we told it to use more English. AI won on the empathetic scale simply because it was consistent in how it responded back, where sometimes we were a little short and curt because we're doing this at 9 o'clock at night. But there was 2 important things that came out of only I learned through the conversations, because all that was in a paper I could have read. One, there still was a doctor in the loop. So generative AI may have written the summary, but the doctor still reviewed it before it went to the patient, right? So it augmented the clinician. It didn't replace the clinician. And I think we're going to be for that for many different places. The second thing is when you ask the clinician whether it really saved them time, what they said was actually not much, because here's why. I have to take time to write my summary, or I have to take time to read a summary if it's generated for me. But the cognitive load is a lot less if I'm editing something versus I'm writing something from scratch, right? So there's a lot of learnings in there as we continue to look forward about the things that can work and the things that what we think will work, but maybe not work in the way that we intended. And that's why I think we just have a long way to go in healthcare.
I want to sort of follow up on one of the comments made, and that is, when a patient tells you a story, there's a whole lot of red herrings in it. There's a whole lot of things that are not relevant to the diagnosis. And I think that's where maybe AI will solve that at some point, but that's one of the challenges of having a machine or a computer, because when you're interacting with a patient and when you're thinking it through, you may be thinking about, well, this patient really has 3 or 4 different problems, whereas the computer is trying to put them all together. And as a clinician, you have to be able to sort through which are the ones that are relevant. And I think we're a ways from doing that.
So I'll add to that. I think I'll make 2 points. One is that AI, it's generative. And a lot of times we don't have data in everything we're seeking when it comes to a complex patient, when it comes to a complex diagnosis. And so when that data is missing, what does AI do? It makes it up, right? And so I think that part, the AI hallucination, that's still, and I'm sure that will get solved over time, but as we push innovation, there will always be areas where we don't have the data yet. And so that does, I still think, need some kind of human expertise and intuition. The second part is, and this is, you'll see my bias from integrative health, where we treat mind, body, and soul, is the interactive human part, the human relationship. And we call it the therapeutic relationship. And so it's actually been shown that you can even establish this in terms of the distance you need between 2 humans to have a therapeutic relationship, and that distance turns out to be around 5 feet. And certain things we're learning now why, but there are certain things like cortisol levels that you have on your skin, or, and we used to think of these things as pheromones, those do have an effect on another human being. And so when it comes to, medicine, to healing, that therapeutic relationship, going over a difficult diagnosis, going over a very complex treatment plan, having a human on the other side, I think, and I could be wrong about this, I think at least for the next 10 years, AI probably can't do that.
Building on, or the flip side of what Dr. Malik was just saying of we don't have data, even if we do have data, it doesn't mean that we should always do the analysis, or that we will be able to, if we have the analysis, to carry out the AI to do it. Example coming into my mind right now, just with the topic of the New York Times suing OpenAI, and I think this will come out probably within healthcare in 3+ years, battled in courts or wherever it is. But right now, a lot of you probably are aware of New York Times suing OpenAI, saying you can't take, GPT can't take my data. This is our data. We learned our lesson 20 years ago from Google taking all information from New York Times, and we're not going to let it happen again. And I think with healthcare, just because we might, there may be accessible healthcare data where you can pull data about patient records or pull information and create different AI analyses, just because that can be done doesn't mean it always should be done. There may be some ethical issues with it, and it doesn't mean it always can actually be carried out. So for entrepreneurs looking to build LLMs off of healthcare data, you may want to think in the future of, are you going to potentially be stopped by policy for something that you're doing, just being out in the forefront of thinking of, what are the implications of things that are happening right now in other areas, like with New York Times.
Along those lines, I mean, there are a couple of sort of danger points have now been mentioned by a few of you. I think it might be fun. It's a little bit of a challenge to do this on the fly, but could you make up a story of when it goes horribly, horribly wrong? Give an example around one of these things, a situation where we have over-reliance on AI, or where it's used in the wrong way, or where the data's processed improperly. What would be a sort of a real situation? Here's Johnny. What went wrong? Or Peter Anteater. I don't know. Can you do that?
Well, it's hard for me to come up with a specific scenario, but I mean, imagine a child has, some sports-related injuries, but now they're here for a fever, but they're also saying, by the way, my leg hurts and I've got this fever. If people try to put everything together without necessarily thinking through, is this which are related and which aren't, you may certainly, the computer may recommend somebody undergo some invasive procedures or undergo some additional testing. And we know that every time you do additional testing, every time you undergo procedures, or every time you take a medicine, there's a risk for something bad to happen. It might be a tiny risk, but if the computer is sort of taking all information and trying to come up with a solution without saying, wait, this is relevant for today and this one isn't, I could envision people then undergoing additional unnecessary tests that have their own risk of complications and problems. So that's the one I can think of.
No, I think part of it is just the reliance on the expertise of the AI. And so I was at a demo for a chat AI that was specifically being designed to help prep pre-op patients. And so, we have a lot of inefficiencies in the healthcare system. And one of the things I'm very hopeful about is the use of AI in billing scenarios and creating greater efficiencies, because we do have a very clunky system compared to any other industry, right? So I think there's a lot of hope. But in this scenario, with the AI going back and forth with a patient who had questions about, the supplements they were on, right? And whether they should stop the fish oil before the knee operation. Again, where the data are missing, the AI wasn't able to give an appropriate answer. But I think also the longer the conversation went and the reliance of the patient on this expertise, the AI never says, I don't know. And so it does come up with answers, and those answers, in a conversation that's gone back and forth for 15 minutes or 20 minutes, where is that, additional checking? And so I think there are, I think as you do iterations of conversations, that ability to check it, again, I think it's something that will likely be solved, but at the current moment, I think there are still issues with that.
So I think those are great. Did you have an example as well? Or do you guys want to come up with?
Chair, I don't know
the
if you have
nightmare?
an example.
Oh, if I have an example, I was challenging you all, so I wasn't thinking about that. I guess a lot of it would come down to some of the things that Colleen was saying, which is that, when I walk into a patient's, I'm a child neurologist, and if I'm sitting there with a patient, and there's a lot of nonverbal information in the room, and you couldn't even write it down if you tried. It's when you talk about the headaches, you see dad rolls his eyes. When you ask the child to get up and walk, you see mom suddenly jump up and try and help the child walk, even though they're fine, right? There's all of this unknown stuff in the room that's critically important to your diagnosis and ultimately how you're going to phrase what's going on. There's the selection of data. We were talking before this. There's an example back in the early days before we had the term AI, I suppose. There were these medicine diagnoses programs, and you would type in, what you had to do is you type in the symptoms, and then they would give you the answer of what it was. But of course the problem is not that. The problem is the typing in of the symptoms. What are the relevant symptoms? What tests should I get? And which ones do I ignore and which ones don't I ignore? Just because the white count is in the normal range doesn't mean it's normal for that patient. You need to know what was going on, what's the context, how worried are you about this person? Now you could imagine an AI system that kind of figures this stuff out. But they're averaging over every piece of data and every person they've ever seen. And at some point, I think a lot of the problems is average medicine is just that. It's average. You're trying to look at individuals and assess information there based on knowledge of mechanism. What makes sense? Just because this is what's happened in another context doesn't mean it makes sense here. So I think you can get sort of nonsensical things happening, nonsensical recommendations, things that sort of don't pass what most of us would consider sort of a common sense sort of smell test. And then the other thing I think is the over-reliance on the data, where you see people, they're like, okay, the AI said that's what it is. Coming from, I guess, emergency medicine, coming from cardiology, I was taught for a very long time, when you get an EKG, the machines for a very long time have been able to interpret those things for you, come up with little statements, right bundle branch block, or sinus arrhythmia or something. And we were always taught, just ignore it. It doesn't matter if it's right or wrong. You don't care. You don't know. It's not telling you how confident it is. And so you just ignore it and make your own assessment. And I think that's the risk, is that AI people aren't being told when to ignore it.
Yeah, right now, I think medical care is provided based on consensus and research. So there are Health and Human Services, there are guidelines of medical procedures and care. There's within the clinic, the staff meet and decide recommendations. But thinking to the future, I could imagine AI is the recommendations, and it's going to be changing by the minute with each patient. And technologies are, the benefit and risk of technologies is that they can scale things really quickly. So you can imagine scaling a whole bunch of incorrect procedures or problems that haven't been properly vetted just because we have belief in the AI as the truth, and it's no longer going through the process of having recommendations that are made and tested and slowly scaled out.
But I think at this point what I would like to do is now flip this around the other way. And I think someone, Tom or Sean, I forget who mentioned it, the idea that AI functions as a tool. So what would AI look like if it were maximally useful to clinical care?
I can start with that. I think, when it comes to preventive medicine, right, and optimizing wellness, that's something that's not been really part of, the medical system in a large way, because when it comes to optimizing your own health, the data that you need, the continuous data on sleep, on nutrition, on lifestyle that you need is just not something we measure in a regular physical, right? And our physical, by the way, hasn't really changed since the 1950s. And so now with wearables, with technology and the use of AI to then harmonize all that data, because we started seeing all this data, but it was actually very overwhelming to tie it all together in a medical appointment, in a 15, 20-minute appointment. But now if you have AI and the patient can upload this lifestyle data, the AI could probably pinpoint and create patient dashboards to say, this is an area that needs attention, and this is how you improve your health over the next 6 months. This is where the biggest bang for your buck is, because we can't do everything all at once. And so I think AI synthesizing data and showing where the greatest impact for somebody who wants to stay well and not wait for that heart attack is a huge potential and very, very exciting.
This is probably not the only thing I would want it to do, but one thing, when I'm looking at a patient, I'm often thinking about, okay, what is the most likely explanation or the most common explanations for this person's problem or symptoms? But I'm also asking the question of, what is the thing that would be a disaster if I missed it? So it might be rare, but I don't want to miss the cancer diagnosis, even though I don't think that's what it is. And so I think AI would be great if it would say, sort of help me make sure I've thought of all the really rare things that I can't afford to miss, just to make me double check, am I sure that's not what's going on? I think a lot of clinicians take that approach of, here's the most likely things. I'm not going to worry about the rare things that I can figure out later, but I'm going to worry about the rare things that might be a disaster if I miss them. And anything that would help me think of those things is a help.
I think we're also going to have the opportunity to learn how much we do not know about medicine, about health. Just as a scientist, as an academic, there's so much work that you either never do the analysis on because you don't have time, or you don't think it's going to turn into something, or it doesn't get published because it's a null finding. But when we have machines being able to quickly analyze all kinds of information, I think we're going to get all kinds of discrepancies in findings and things that we thought we knew, maybe we're now getting a different finding that contradicts that. I think it's going to cause a lot of confusion to some extent, and we're going to have to come up with ways to figure out how do we make sense of higher quality AI analyses, and it's going to help us learn what we don't know and kind of pave the way forward for what we can know.
I'm going to go from a different perspective. I'm looking forward to AI helping each individual feel more empowered around their health journey. The combination of the data that I might collect as an individual, and Dr. Malik knows that I collect a lot of data on myself. I'm one of those crazy people. But then also information that is not just information about me, but also all of the collective intelligence that research has been done. If that's pushed to me as a tool to help me make better decisions, to keep myself from having the need to have an episode in the healthcare system, everybody wins. I'm a healthier person. I don't put an extra burden on the healthcare system. The tool gives me a quick answer to that question, so I don't have to schedule an appointment to take a busy set of medical professionals to address something that was very straightforward. So I'm hoping patient empowerment comes through this, because if I'm worried about my financial situation, I open the app and I check to make sure there's enough money in my bank account to pay this month's bills. Why can't healthcare information in my health journey be empowered in the same way? So maybe AI can help with that.
And I think one of the things that I often think about is AI isn't really a choice. Big data happened, and we got to do something with it. And big data can be big data from you because you're self-monitoring and you now have information coming in every second about multiple bodily functions that are changing time, and it's hard for you to process that. Big data could be the differential diagnosis. Now, every day there's some new gene some disease we didn't know existed, and trying to keep the lists of those things in your head becomes impossible. Big data can just be, how do we sort through the literature, which is growing at an ever-expanding rate. It can be, how do we look at the hospital database and look for either emerging or common diseases or things expect or patterns in the data. So in some ways, you don't have a choice about whether or not to use AI or something like it. So I guess my final question to the group would be, given that we essentially, the data has happened, we need some way of processing it and doing that. Obviously, there are risks associated with it. Who and how do we mitigate those risks? What's the right way to make sure that as we create these new technologies to deal with the flood of data, that we're doing it right and we're not going to hurt anybody?
That's such a profound question and great question, Terry. I think if we think of AI, and you brought this up in an earlier discussion, simply like as advanced statistics when it comes to data, right? And we think of all the tools that we as researchers use to make sure we're not, correlation isn't causation, and things like when you have a lot of big data, there's something called multicollinearity, where, artificially things are correlated when they, in the true world, aren't. And so I think there has to be some kind of validation process. And I think all of this is kind of in step with each other as we're generating all the data, when it comes to our genes and what causes disease, and even common diseases, right, like heart disease. We now know there's about 200 genetic variants that if you compile them together, you can predict someone's risk for an early heart attack. And so those are things we're doing, in kind of the old clunky fashion. But when you start to congregate all this data together, doing the same kind of validity checks, using, dividing the data and having a data set where you validate all your models, I think will be something that will be increasingly important.
I'll just add on to that, because there is a proposal in Washington with Health and Human Services to set up kind of use academic medical centers as AI validation stations for all of this AI development and tool development and assistive augmented decision making. We need that type of vetting in place with real medical professionals really overseeing how the validation works. And then, the medical community has its trusted sources that it looks to before it makes its decision. And I think a lot of these tools coming through those already trusted sources is the best way for it to work.
I was on a panel where we gave recommendations for CDC, an AM panel on use of AI for STI prevention, and so I think I can broaden that out. And the recommendation with the help of the policy people was we need to have ongoing meetings and guidance on the ethics and use of AI in medicine, need to have multiple key stakeholders at the table. Of course, clinicians, healthcare administrators, ethicists, just kind of the whole kitchen sink of patients. And what I think is often missing because of attention and it's good that we're having this here at the Cove, but a tension often between academia and industry. I think it's really important that industry is at the table of these ethics meetings also, because entrepreneurs are often pushing the envelope on what can be done and on the ethics of things. And then academics and ethicists are often pulling it back in the policymakers. And I think everyone needs to be at the table disclosing as much as they know, having this shared decision making so we can arrive together at a decision.
No, I'm good.
Okay. Well, let me thank the panel for a spectacular and thank the organizers for having us here, and thank all of you. And in advance, I want to thank the students for the tremendous work that they're doing on all of these projects, which I really look forward to hearing more
Round
about.
of applause. And we have a gift for you. Students have a gift for you. Thank you. And we'll take your microphones. And Alex, can you please change the slide? All right, another round of applause for these people who we really don't want to see, because when we see them, we're in trouble, but then when they see them, they save us. That looks like Tom's. Tom likes to take notes. All right, we are rocking and rolling now. You know, anything goes in a pitch competition. I tell students all the time, be prepared to be unprepared. We have 5-minute pitches with planned 2-minute Q&As. Because we're running behind schedule, we're chopping the 2-minute question and answers, and judges, you just get one question. They're going to answer it, we're going to move on. Now, this is going to be high energy, this is going to be fun. We have 16 teams who are going to show their wares. Now, I want to let you know, this started with an event that had over 350 people at the Entrepreneur Center. From there, 85 teams were formed. From there, 61 teams made a 5-minute video and made it to the semifinals. And from that, you have 16 that are standing here today. 5 per track, but the storytelling and entertainment, it was so close, a tie between 3. We're having all 6 compete. Dose is up on deck. Are you ready? Yeah. Are you guys ready? All right, let's get this energy going. Why don't you guys come in here, get yourself plugged in. And Alex, this is where we want to make sure that we're changing to the next spot. Good. Look at this. Now, students, it's all about the transition times. Judges won't judge you on it, but I will. So make sure your computer's ready, make sure it's turned on, make sure you're ready to plug in. And I'm sure something will go wrong. Look at everybody, judges. You've got your rubrics, we've got pens. There is food, so you can slowly go and get food. It'll be there, there's tons of it. All right, they're there, they're here. Microphone is going to be here. You don't have to stand at the podium. You have a clicker, okay? I would go away from the podium. Don't stand by the podium. Go in the middle. And I'm going to turn these microphones off. All right. So, if if you've got an idea, why don't you pitch it right here? If you want to change the world, I'd love to hear. Now, it could be big, or it could be small, or it could be for profit, or not at all. Some are going to win, some are going to lose, but the future is still up to you. You're ready for this? On your mark, timer, 5 minutes here. You've got your confidence monitor. Don't look behind you, please. It's all right there. 1 clap together to get this thing started. On the count of 3, clap together. Don't mess up. It's going to be 1, 2, 3, and then clap. 1, 2, 3. You don't have a microphone, dude. There you go.
Sorry about that.
There you go. Let's try this again. If you've got an idea, why don't you bring it right here? If you want to change the world, I'd love to hear. Now, it could be big, could be small, or it could be for profit, or not at all. Some are going to win, some are going to lose. The future is up to you. Let's go. Kick it up for these guys. Woo!
Thank you for the introduction. This is your K-pop star, Jaewon. This was my best joke, guys. Come on. Okay, today, let me introduce our new venture, Dose, your personal drug management application. There seems like a technical
Okay,
issue.
everyone, freeze time. Everybody close your eyes. Oh, wait a minute. Okay? Everybody, no, you go back, you go back. On the count of 3, I want you to clap, and at that same time, I want you to try your screen. Okay? Don't click until 3, because the power of the audience here. On the count of 3, all together, 1, 2, 3. You're supposed to push it. Did it work? Oh, jeez. Try it again. We have a little bubble that's jumping too. Looks like somebody's trying to message us on Discord. Oh, wait, no, wait. Oh, I see, yeah, we need to put it in here. Okay, this is what's happening. We're gonna do this. Then we're gonna do this. We're gonna plug this in over here. Okay, good. We're gonna go to the side. Everybody, give it up for Alex. He's saving the day right here. This is crazy. Alex. Uh-oh. Maybe he messed it up. No, now he's back. Yes, allow access. All right. Almost. You know, when I do tell people things will go wrong, they always do go wrong. Click forward to get good, okay? All right. Woo! Round of applause. Some are gonna win, some are gonna lose. The future is up to you. Ladies and gentlemen, Dose, you're up. Ready? Let's do it. Reset the clock, Alex, please.
Yeah, you know, technology always makes mistakes, right? Okay, let's start it again. This is your K-pop star, Jaewon. Right? Okay, today we're going to introduce our new venture, Dose, your personal drug management application. Before we start, I have a simple logic question. What is good plus good? Anyone? Okay, we're naturally inclined to think that is good. However, sometimes too much of a good might be bad, especially when it comes to dietary supplements. Okay. If you arbitrarily consume multiple dietary supplements at the same time, some of the substances inside might conflict with each other. And it might even conflict with prescribed medicine. Let's just imagine the slide works, okay? Right? Let me give you an example. If you take a combination of warfarin, which is prescribed medicine, and vitamin E, which is dietary supplement, which is both blood thinner, it might lead you to potential bleeding complication, including internal bleeding. Also, over-consuming vitamins can modify its efficiency, and also it can lead to toxicity. However, nowadays there is no law requiring FDA to authorize dietary supplements. Therefore, the only available way is to consult with experts, like dietitian or physician. But it both costs money and time. Nowadays, about 35.9% of 20 years or older US citizens taking multiple dietary supplements. Even worse, 53.6% of 60 years or older US citizens taking dietary supplement. They're vulnerable to side effects caused by taking multiple dietary supplements.
So this is where our app Dose comes in. So I'm Calvin. I work with Jaewon on this project. So our solution is to use AI to assess supplement conflicts and design personalized medication schedules based on the user's individual data. So on following, we're going to show you a Figma drop of our app, which we will put into development after this. So on the first slide here, you can see that one of the key parts of our app is a medication scheduling app. So you're going to be able to track when you took it. It's going to tell you when you should take it, how much of the dosage. You're going to be able to track it. We also have daily streaks and progress bars. So we are gamifying the interaction so that users will be incentivized to take it at the correct dose at the correct time. In addition, you have your user profile, so you're going to be able to put your personal information in there, as well as your medical conditions and things like how often you work out, because that affects how much you should take of a supplement. So the main ways to look up a supplement on our app will be through scanning it and then manually typing it, which is the boring way. This way is convenient and also uses optical character recognition to look up your supplement, and it's just a lot easier. So when you look up a supplement, it's going to highlight the supplements that conflict with it, or like prescribed medications that conflict with it, as well as organize and present the information in the drug facts in an easily understandable way for the user. Another key part of our app is going to be community engagement. So we're going to have a forum page where users will be able to make posts, share their experiences, and ask questions. This will be content moderated through things like third-party software such as Amazon Recognition. So you might be wondering about how we're going to generate revenue. One of those parts is going to be a commerce, a shop within our app where you're able to search up for supplements to purchase. In addition, through AI analysis of your medical profile, things like your age, height, and weight, you'll be able to be recommended for supplements or warned against supplements. For example, most seniors older than 70 are vitamin D deficient, and thus you would be recommended those type of supplements. So finally, our app provides an AI assistant to answer questions and translate things from medical jargon into easily understandable text for the layperson. In addition, for further clarification, we will be offering users to ask a medical professional through a small fee. So there's a lot of apps out there that are additionally, they're like a medication scheduling app, yeah? And some apps also provide information on drug interactions. However, the problem is that they don't provide both together, or if they do, it's inconvenient to access, or just has too much information that's irrelevant and difficult to understand. Thus, this is where Dose is better than our competitors, since we have our instant conflict check that automatically applies, so you can instantly look things up without having to put them in a separate part. Our information is simplified and easy for the layperson to understand, and our medication schedules are personalized based on the user's data. In addition, we'll be learning and growing as our AI keeps learning, and we have expert feedback through medical professionals. So our target population is going to be in reducing the 60,000 medical visits a year due to supplement interactions, which racks up quite the medical bill. Our target population would mainly be fitness enthusiasts, of which 85% take supplements such as like creatine or ashwagandha to improve their performance, and the elderly population, which as Jaewon mentioned earlier, has a large percentage that takes many supplements a day. So our business model is going to be free for the users, generate revenue through e-commerce through our app, and offer a subscription for companies.
Okay, in terms of marketing method, we're going to use advertisement and collaborations with influencers. Also, in order to make sure there's no medical misinformation, we're going to cross-examine data from Lexicon and Drug Bank. Also, we're going to use a government source data to make sure it is reliable. So, in order for users to have information to make holistic decision, we're going to make physicians readily available. And for vendors, we're going to make sure they write a HIPAA compliance to make sure that data is safe. Also, this is our team. Thank you so much.
Extra round of applause for them just for going first and getting the Band-Aid off. Nice job. You should be real proud of yourselves. Drop your mic, or actually, your question. One question from the judges, and Team Saddleback, if you can start getting set up over here. Any burning question from a judge?
I have one. So what's your competitive... Hello? Thanks. Push too many buttons. What's your competitive moat, and is there any network effect opportunity in your business?
So, can you please explain what competitive moat is?
What are you going to do to keep somebody else from copying and competing with you guys with the same idea?
Okay, so although we have competitors like Sub.ai, which is really great application, but we have different competitor. We're different than competitors in like. Let me do it again. Sorry. So since we're starting first, we're going to get users' information on like how to interact with feedbacks on whether it works for them or not, and we're going to use that data to train our own AI model to make it better. And Calvin, do you have anything to add on?
As for people copying our data, we are in contact with the UCI Law Department and people in that to work together on creating a business and all the legal things that come with it.
Thank you.
All right, round of applause for Dose. Nice job. All right, we got Saddleback coming up. Judges are doing some scribble notes and things like that. Now, as the judges are doing, the transition is happening. Let's go plug in if you can hear. You guys got this. Here is for that. And you also want to plug in that HDMI to that. All right, this microphone's really hot. Mic 1, mic 2, mic 3. As a raise of hands, how many people would be interested in downloading that app? Supplement. How many people take supplements? Okay, how many people would be willing to try an app that is helpful like that? Okay, look, you got a lot of people. Dose, I don't know if you saw it. They're like, oh yeah. We do have this one on our end over there, if Saddleback maybe. Let's see. Let's see, we're working it here. All right, look to the person next to you. If you don't know them, say hi and introduce yourself. Let's use this time here.
Good dinner. Yeah. Yeah, he said just go grab something.
Is there water and stuff there?
Yeah. Yeah.
Do you guys want anything?
No, I'm good.
Yes, no?
Get it now while there's a break.
Okay, this is good. We got movement. Some people going to food. Not everybody leave. This is like a wedding. Just get a few. That's enough. Good. We have your PowerPoint pulled up there? Okay. We got it from the back there. Where do I plug this in? This is going to go down here. Right here. Okay. See if that'll work. No, it's going to be this one. Oh, sick. All right. Who's speaking? I'll go first. All right. Another one? Do you need 3? Yes. Sure. Yeah. All right. Here we go again. Find your seat. These gentlemen are going to take this stage. Clicker works, we think. 5 minutes on the clock. Are you ready? Yeah. Are you ready? Let's go. All right, action.
It has been estimated that there have been 106,000 deaths as the result of adverse drug reactions annually in the United States, of which a substantial portion are entirely avoidable. In pediatric context, an analysis of 52 leading children's hospitals revealed that drug-on-drug interactions totaled up to 47,414 cases alone. This highlights a significant area for improvement in pediatric healthcare.
Currently, more than 1,400 medication are available in the United States, with about 20 to 30 new medication being FDA approved each year. Given the rapid nature of drug development, it becomes increasingly impractical for a single healthcare provider to manually assess every possible combination in medication that may result in adverse drug reaction to a patient. Predicting reaction is even more challenging in pediatric and neonatal patients, where the incident of adverse reaction may be complicated with drug overdose, placing them at an even higher risk for serious adverse drug reaction. This underlines the critical needs for enhanced tool technology and collaborative efforts to ensure the safety and effectiveness of healthcare intervention.
Today, medical literature is freely available online, offering a large corpus or body of valuable text information. Our strategy involves the utilization of large language models such as GPT, more specifically Llama, trained on text to interpret medical records and literature. These models can then build knowledge discovery graphs by extracting pertinent entities and relationships from unstructured text, facilitating a systematic review of potential drug-drug interactions based on the structure of the graph. Our team is composed of 3 researchers with diverse backgrounds and perspectives. Max Ream and Jasper Doan are third-year computer science and software engineering majors under the guidance of myself, Nadia Ahmed, a machine learning adjunct faculty member at the University of California, Irvine. Today, together, we have combined applied AI research experience in applications such as self-supervised learning for remote sensing, risk assessment for spaceflight, radiation exposure, and control systems for robotics. Empowered by this dynamic team with a proven track record of software engineering and machine learning best practices, we seek to use artificial intelligence to revolutionize the landscape of pediatric drug interactions. For example, when our trained model encounters new patient data, it seamlessly processes the information to generate predictions regarding the potential occurrence of drug-drug interactions or adverse reactions to a drug. What sets our approach apart is every stage of our inference process is linked to a specific relationship and factual data encoded within the knowledge graph. This means that each conclusion can be traced to the explicit information stored in our knowledge framework, thereby making it explainable.
While our model will be trained on a publicly available medical text, a critical gap in the realm of pediatric drug interactions and their associated side effects must be filled. We propose leveraging anonymized reports detailing drug side effects in pediatric patients with a specific focus on those in the pediatric intensive care unit. Patient reports are crucial because existing drug interaction data is disproportionately centered among one specific demographic, white males aged 18 to 30. Our target is leaving a substantial gap in our understanding of pediatric drug interactions. Our target market is the Children's Hospital of Orange County, and more specifically, the PICU. Collaborating with CHOC will not only help us fill the data gap by incorporating pediatric case reports and model training, but will enable the development of a sophisticated tool. Additionally, by engaging medical staff in our validation process, we aim to implement a human-in-the-loop approach, ensuring that the tool's output is examined and verified by medical experts to enhance its accuracy and reliability. This tool will analyze existing adult drug medical text alongside pediatric doctor notes, culminating in a solution tailored to the specific needs of CHOC's specialty pharmacy.
Our innovative approach not only fills a critical data gap, but has the potential to prevent adverse drug reaction, thereby enhancing patient outcomes with cutting-edge technology and compassionate pediatric care. The path ahead is not merely about expansion. It's an invitation to pioneer a new era in healthcare, where every insight gained becomes a stepping stone towards a healthier, more informed future for our youngest patients.
Thank you.
All right. Judges are making notes. Does anyone have a burning question? All right. Turn your mic on, Mr. Lewis. All right. I'm coming to save you.
Got it.
There you go. I'm passing by.
So it sounds like you have your solution well thought out and your presentation is very good, but I'm wondering how far along is the science underlying the solution? Like, are the LLMs being tested? Have you guys developed any? What is the state of the actual technology?
So it's been proven that essentially large language models really parse through unstructured text data, and they extract important entities within sentence structure and grammar. And from that grammar, you can build these knowledge graphs And the knowledge graphs would have nodes and links between them. And people have been able to successfully implement this in other literature, like academic literature. It's been used in policy as well. More recently, there was some work done by a startup company whose name is escaping me that did this for COP28. They went through all of the global stocktake that was done of climate policy, and they essentially leverage large language models to create these knowledge graph representations that could then discover close links, so they can do link prediction or they can do node prediction once you build these graphs. In terms of the state of our project, we're still in the initial phases. We're hoping that we do well today, and then we can spin up a prototype, one that hopefully can leverage partnerships with stakeholders such as CHOC's Children's Hospital. I think what makes this project unique is that there really is an understanding that there's a true data gap that exists, and that traditional techniques that are used on just passive data, medical literature is really not enough. There is like an aspect of actually doing data gathering and working with a stakeholder in a collaborative fashion to really understand and address their needs that I think it should really be highlighted here. So creating a prototype that moves forward is going to require that sort of collaborative effort before we have substantial predictions and confidence intervals around those predictions as well.
All right, no need to hope that you did good. You did great. Give them a round of applause. All right. Next up, Kido Care gets set while the judges are putting their love notes together. She's got the microphone. You got the clicker too?
Yes.
All right, everybody. We're ready for number 3, and as you see, we're getting better at this. Judges, you're doing great. Students, you're doing great. Clap on the count of 3, and we'll set this one off. 1, 2, 3.
Hello, everybody. My name is Gada Joyce, and we're here to present to you Kido Care, the AI angel for little warriors. So at the age of 13, I found out I had to be hospitalized due to a health condition called scoliosis. And if you don't know, it's a sideways curvature of the spine. And at that time, I felt so down, and I needed someone to accompany me and be with me all the time. And let's be honest, it's too much to ask. So what I did was I created this imaginary friend. I named her, spent time with her, asked her all of my questions. The thing is, she never had an answer. And so I fell into a deep hole of depression and anxiety.
I heard and related to her story. As a nurse who worked in pediatric care, I've seen many of my patients had these feelings. And at the other side, there were parents who couldn't do anything for the loneliness of their children because they had to leave their children at the hospital alone. And it was our dream as healthcare providers, parents, and children as well to have a care companion. So as researchers, we realized that we have around 5 million hospitalized children in the US, which stay at the hospital for 3.5 days. NIH reported 53% of them experience depression and anxiety. And on the other side, 62% of their parents experience anxiety as well. And how we expect healthcare providers to address this problem? Because they have 4 patients for each nurse. So that's the sweet point of our story. We came up with a dream team, consists of people from various backgrounds and expertise, from AI and data science, health science, user experience, research, and business, as well as our faculty mentors, to come up with the idea of Kido Care, AI Angels for Little Warriors, which is a personalized AI-driven care companion for children, with the goal of improving mental health and providing a companionship for children, as well as providing communication through our integrated care hub for parents, children, and healthcare providers. And at the end, our greatest goal to refine pediatric care model. In order to pursue our goal, our Kido Care provide personalized companionship and support for children, as well as multimodal interaction, which has text and voice, and provide an AI-based conversation for the children. And we provide mental wellness evaluation based on the conversation. Also, we recommend interest-based entertainment based on the conversation and the evaluation. And also, we update parents and healthcare providers about the mental status of the children, as well as provide health metric alert system that you can see on the right side of the page for the healthcare providers. So, as a result of this interaction and communication update about the mental wellness, the Kido Care provide the opportunity for potential communication between healthcare providers, patients, and the parents. And that's how we provide integrated care hub for our three main stakeholders. Our AI model consists of a generative AI, NLP, and language model, in addition to sentimental analysis, which calculate the mental wellness score and provide the AI response that you can see a sample of our AI response here. And if you are interested to know more about our AI model, you can scan the QR code and see our GitHub. Our market size starts with Chalk Hospital with 334 beds, serving 2 million patients annually from 4 counties, and go with South California, California State, and US hospitals for the next steps. Our revenue stream contains 2 tracks: individual users for $20 per month, and organizational users for $100 per bed annually. And in our competitive analysis, you can see that we have pretty low price in comparison to our competitors, as well as no risk of infection. And about our timeline, we are going to develop and test our MVP in 2024, and hopefully we can launch our pilot at the Chalk Hospital in 2025, and in 2026, we are going to have official launch. And that's how healthcare providers, patients, and parents' dream came true with Kido Care. Thank you.
All right, judges, do you have a pressing question? Una pregunta. Yes, Renee. Renee from Microsoft. Give Renee a round of applause. She's now working with the Entrepreneur Center. And by the way, students needed OpenAI credits, Azure credits, and so we had them coming in constantly asking, so they made little videos. We sent them to Renee, and she set it up, and we got $5,000 of OpenAI credits that everybody played with. So, yeah, Microsoft, thank you, Renee. We're trying to get Sam Altman to come speak.
I really like this. I had a question. You mentioned providing updates to the parents and measuring the mental state of the child. How are you measuring it? Is there something on the app?
Maybe I can answer it like more accurately to you. Right now, the model that we are...
Hold the mic close.
Can you hear me all? Okay, great. So the model that we're using right now is the pre-trained VADR language model, which is going to analyze the sentiment score. And each time that the companion, let's say, talks to the kid, we have a feedback loop, which in each answer, you update the weights of the words, and if it is from the negative going to be positive or more positive, the threshold could be let's say, understand it, and then if it is going to be like above the threshold that we define, like over 0.5, then that could be reported, or even if it is going to be less than that, even that would be reported to the parents.
Yes, and in addition to that, the baseline survey that we used for training our model was a brief mental health survey, which contains the words and the phrases that might show mental states in children is validated in this population. Thank you for your question.
All right, Renee smiled after that. That's good. Round of applause. Hand your microphone to this team over here. Hand a microphone to the team over here. There you go. I'll take this. Other microphone. Judges are making little notes. You're all thinking to yourself. Comments, you're all really judging them as well, I know. It's okay. Judgmental, yes. Now, remember, a whole part of this is just how we help these students with the next step. So if you hear something, right, or you see something, then say something. I was traveling today, so I've been working on that. But see something, say something. If you can help one of these teams out, regardless if they win, that would be great. Okay, yes, use this. Wait, give it a second. There it goes. And then let's just do continue. I think we get rid of this. You want to click forward and back? Good. All right, ladies and gentlemen, put your hands together for Move AI.
Meet Raphael. He has dystonia, a neurological movement disorder that locks him inside his body. There are 300,000 others like him in the US. For Raphael, clinicians evaluated different treatment options and decided on deep brain stimulation, or DBS. A boy who was told he will never be able to walk was enabled to play baseball. This is not the case for every kid. Some are misdiagnosed, and for others, the best treatment remains undiscovered. Imagine a world that for every child, the path to the best treatment is fast and certain. That's our mission at Move AI, and we achieve it with an assistive evaluation platform. I'm Rahil, the CEO, and here are Sina, Jamie, Ali, and Milan, and we are actively looking for someone with background in business. Move AI originated in Sanger Lab, where we faced the challenge of evaluating quantitatively evaluating movements to find optimal stimulation setting for children with dystonia. Such quantitative analysis could also promote early and accurate diagnosis of movement disorders. Currently, physicians rely on time-consuming and subjective visual scoring of patients when they are doing specific movement tasks. What if we could empower our clinicians with a fast and objective assistive tool, a comprehensive evaluation platform?
We propose an innovative solution combining video, computer vision, and electromyography, or EMG. The camera and EMG sensors would collect the movement data. Then the computer vision would extract the movement parameters in the video, and EMG analysis would get the muscle contractions, which are hidden from the camera and possibly clinicians' eyes. And together, they provide a quantitative analysis, which includes the clinically approved movement evaluation skills, but even more. Not only that, but even more. Let me show you how the computer vision part works. Okay, so this is a live feed of my webcam right now. So as you can see, first we detect our landmarks, which is pretty robust. Then we can extract a variety of features. For example, this is the range of motion of my elbow. And then we can also track, for example, the time of a certain task. This is a fast movement, and this is a slow reach. And then we can also track your hand trajectory to measure its dexterity. Our software solution can objectively compare and evaluate different treatment options. It provides EMG analysis, which is known to have immense informative value. It also can produce charts to track the improvement of your mobility during the treatment, for example, rehabilitation from stroke. It can process hours of footage which were not being processed before due to time constraints. And additionally, using our AI algorithm, it can look for early biomarkers of different movement disorders.
In the world of AI, there are various companies that collect and analyze data in order to improve mobility. Some are versed in computer vision, others in full body tracking, and others in biometric sensors. We're different because we use motion tracking in order to aid the clinical treatment of movement disorders through an AI-based platform. So why us? We're a cost-effective, software-centered solution. Our data-driven algorithm grows stronger with every patient, leading to exponential growth potential. Our solution, propelled by recent advancements in AI, machine learning, and the recent Sanger Lab publication, allows for precise and efficient movement data analysis. But you also may ask, why now? The market is ripe for AI-based evaluation platforms, and clinicians are increasingly ready and willing to adopt these emerging AI solutions.
For our development plan, during the first year, we aim to
focus on completing our MVP and releasing beta. For the second year, or the second phase, we actually aim to partner with CHOC to showcase our product impact in treatment of dystonic patients. For the third year, we aim to expand our solution beyond dystonia to other movement disorders, such as Parkinson's disease or essential tremor, which impacts millions. In this case, in addition to partnering with hospitals, we aim to provide pharmaceutical companies with our movement evaluation platform for their clinical trials. In the last phase, which we call proactive health, we have already obtained a vast healthy and pathological database that AI can be used in order to detect early biomarkers of disorders. We aim to launch a mobile app for at-home use, allowing users to record video of their loved ones, and in that case, suggest them to visit a clinician or physician if any abnormal movements were detected.
Our clinician package provides seamless EHR integration and unlimited AI analysis, unveiling in California, then nationwide. We've also provided a pharmaceutical package as we believe those corporations are key in the development of dystonia drug treatments. Going into our revenue streams, we'll fund early through government and research grants, potential prizes, and venture capital, which will be used for development, patenting, and corporate visits. Upon delivery, we'll rely on our sales from those packages as well as government and research grants, which will fund updates, R&D, and rollout. Professionals in the field believe that our multimodal integration, coupled with advanced analysis features, revolutionizes the way that neurologists gather and interpret data. We vow to provide everybody the care they deserve, like Raphael. We are Move AI, pioneering tomorrow's health today.
Boom! All right, judges.
So
over here, Tammy Kim.
Hey, very excellent presentation. So this may be a little bit, I'm not trying to be positive here. You talked about your team, and it's great. This was a really great team, but a lot of your monetization strategy revolved around grants. But I didn't see anywhere in your team that you had anyone that was an actual grant writer.
We actually have a postdoc in our team that is actively writing grants and applied for a grant. Maybe Alireza can talk about that a little bit.
So that's part of our strategy. We aim to apply for grants that can actually help us develop further in this research, and we're actively writing them. But right now, at this stage, that's the plan that we have for the future.
Excellent. Good.
Oh, they answered that. They had it in the back pocket. Excellent. Give them a round of applause. Nice work, team. They got startup shirts and everything. It's official. All right, let's get AI Scan up here. Judges are smiling and writing. We might have to get them more pens because they're writing so many love notes to everyone.
This one.
Yes, please.
Sir, would you like a microphone? Sure. Okay, there you go. All right, take your stages, take your places. You got the clicker? Who's got the clicker? You got it? All right, the man with the clicker. I'm going to take the glasses off because you should never have your glasses here during a presentation. We got your back. All right, everybody, give a round of applause. The last of the 5 for the AI Health Impact Track, AI Scan.
Hi, everybody. I am Sarah, CEO and CFO of AI Scan. Let's meet the rest of the team.
Hello, everyone. My name is Miriam, and for this project, I'm taking the role of the electrical engineer.
Hi, everyone. My name is Rojin, and I am the biomedical engineer of our team.
Hello, everyone. My name is Martin Bobershot, and I'm the machine learning researcher for this team.
Hi, everyone. My name is Tahir, and I will be doing marketing research.
Thank you, team. Imagine the future where your eyes are not just the windows to your soul, but gateways to a deeper understanding of your overall health. Wrong diagnosis is one of the leading causes of death in patients. How can AI help and how can AI scan help with diagnosis? Let's hear it from the team. Rojan?
Thank you, Sarah. So our eye, as the only transparent organ in our body, gives us a non-invasive window to the pathology of the nerves and vessels. So meaning that any symptom observed in the retinal structure can correlate with the ones in our vital organs, such as kidneys. So our eye gives us a word of truth about one person's overall system and health. Diseases such as common diseases such as diabetes and hypertension to the less common ones such as MS and HIV can indicate some signs inside your eye. Now I will pass it on to Mariam so she can continue with our technology.
Thank you, Regine. Our proposed solution is an AI scan device. It's a simple device consisting of the optical lens and a light. With the help of the device and a mobile phone, the doctors are able to take the pictures of the eye retina. Those images are then sent to AI-powered software. The software is not only able to detect the diseases in their early stages, but also save patients, improve the healthcare system, and save money for both patients and doctors. With this, I will pass it to Martin to talk about the AI part.
Thank you very much, Mariam. AI Scan, we will bring AI Scan to life through a convolutional neural network, a state-of-the-art algorithm well-suited for understanding patterns indicative of diseases. Our model will employ a multimodal learning algorithm incorporating patient data optionally. Our training data sets are sourced from UCI Health. We have labeled data sets mapping images of the retina to diseases like hypertension and diabetes, which are not really related to the eye. To add a layer of interpretability, we are incorporating heat maps to pinpoint the most telling in parts of the eye through heat maps. We are also outputting our results with a probabilistic risk assessment model as with a confidence score to bridge the gap between medical professional and artificial intelligence collaboration. Our device can also suggest specialist recommendations to streamline the diagnostic process. To deploy our model, we are thinking of 3 quick and easy steps. After we train our model, we are going to export the saved model into the cloud, which then we will develop an API to pull requests, and we will enable the medical professionals afterwards to make predictions on a user-friendly, web-based dashboard. With that being said, let's talk about the market analysis. I'll hand it over to Tyre.
Thank you, Martin. As you can see, our product is highly innovative and highly competitive because it's not only AI-driven, but also small and easy to use. Our market will be consisting of 3 phases. Phase 1 consists of student health and medical center. Phase 2 will be clinics in California. And phase 3 will be national and global expansion. How are we going to do that, you're going to ask me? Let's take a look at service flow. You can see that our product fills the gap between taking photo of retina and connecting them with doctor for diagnosis. This is how our website would look like for doctors. You can see it's highly innovative. And our market strategy are 3 monthly subscriptions. Not 1, not 2, but 3. With that being said, I pass it to Sarah.
As you heard, AI Scan will become the most critical device for doctors and nurses to help and offer more accurate and more efficient diagnosis. And not only it will be the solution for misdiagnosis, but it will make healthcare more affordable and also save life. Thank you.
All right, I bet we never look in the mirror the same again. I'm gonna look in the mirror and be like, can I see my kidney? I wanna see my heart. Although I show my heart to my wife all the time when I look deeply into her eyes. Now I know There's science behind it. All right, question from any, yes, Eugene Choi.
Yes, a quick question, a good presentation, and I'm assuming this is a medical device and requires a 510K application. Have you thought about what it's going to take to develop and be able to apply for the 510K, and think about the timeline to get into the market?
Yes, let me answer that. Yes, definitely it will require 510K. It is a medical device. Right now, we are planning, like Tyre was saying, phase one will be doing some research with our UCI Healthcare Center. And then after that, once we have all the research and the data behind it, then that's when we're going to submit the 510K. But yeah, I agree, it will take some time, yes.
All right, and if they like you enough, you might get 10K. Who knows? Round of applause. Give it up for everybody here. All right, please put your microphones down and exit. Yes, thank you. Judges are doing little notes, and we are going to take a little break, but wait. There's more. Not one, not two subscription models, not three subscription. No, you guys are gone. You're fine.
You want to subscribe?
I would love the most expensive subscription. And the Entrepreneur Center will pay for it, and the donors and funders will help to raise for that, and it'll all work out. Now, I do want to share something which is cool. There are a whole bunch of other teams that didn't make the stage today, but they're still actively have the chance to work on the idea. So our goal, past competition, not just for these 5, but for all of those that competed in the track, and even if some want to come in, we're going to be holding 3 special workshops with a who's who on clinical design. And for the teams that join, the workshops and go through the work, they'll actually end up with a clinical design plan. They'll have a chance to do a small private demo in front of who's who as far as clinical trials, and we're trying to equip these teams with the tools and an actual clinical plan that they can develop to take it to the next step. So, yeah, student competition, but real world stuff. How's that? Is that pretty cool? Yeah, woo! All right, I did hear a whoop, and she is in a red jacket over here, and I'd like to acknowledge Stefani Rios, who is the interim program coordinator of the Entrepreneur Center, basically a queen. Give her a round of applause. She's helping put all this stuff together. Steph. And in honor of Steph, we'll give you a 5-minute break. Bathrooms are over here. There's some food down there, but do try to come back. We've got 2 more that we're going to blast through. We are canceling a section, and we're cutting down, so we're still on time as much as we can. Go get some food, hang out, talk music, Sir Alex. All right. And Stefani will be collecting the judges' scores. She will be averaging them all out, and then she will be presenting those numbers to the judges, and they can help make their deliberations as they go forward. Andre! Well, all right, during the break, we actually have some bonus questions. This is a new thing. Some of the judges want to know. So who did you want to talk to? What was the question? All right, can I get the last team up here? iScan. Yeah, well, ask them. Is iScan in the room? They got so excited they left. When they come back, we'll see it. This is a Q&A question period. You can talk with people, ask them questions. Alex, can we get a little music still? I don't know what happened. Alex, can you put a 5-minute timer so I can keep myself responsible? And actually, Cynthia, you want to talk about the application thing? I'll just hand this over to you. Everybody, say hi to Cynthia. Say, hi, Cynthia.
Hi, guys. For all of you that just competed in the medical stretch, like Move and iScan, the AI Med Conference that's run by Anthony Chang at Chalk just put out their call for abstracts. You guys should all be applying, and you should all be presenting, hopefully, at the next conference. So please pop on to the AI Med website and submit your abstracts.
All right, thank you, thank you. Let's get a little music going on. See, she saw something, she said something. I'll travel with you anytime. Tammy, Kim, you want to say hi to everybody? And then Alex, if we could turn this to the next setup, which is going to be the storytelling and entertainment. A microphone's on. All right, and in this break here, I'm going to give the next 3 minutes to our Congresswoman, no, not yet, our Councilwoman Tammy Kim. If you're listening, do a little golf clap for our representative here. Yeah.
Listen, I just want to congratulate everyone, all the contestants, for having the courage, the initiative to do really amazing things. I'm just blown away, and I want to welcome everyone here to the city of Irvine. So good luck and congratulations, and let's keep going.
Yeah, Tammy, yeah, Tammy. I've never seen her only take them. No, I'm just kidding. It's good. She's great. Talk to her. This is how you get to talk to the local government here. All right, 3 minutes and we'll find our way. And then we could go to where it has the tracks with the teams, and we will get that so we know who's up on deck. And if the first team does want to come up and get do you have your laptop? Let's get you set up so we're super on it. Yeah, how many microphones do you need? Anybody wants to come up here and pitch their business, we'll have a little time before we come back. A little open mic night for the startup that didn't make the stage. Any entrepreneur want to do a 30-second pitch as we kick off the show? Just open mic opportunity, you know? Going once? Going twice? You, sir? No, you can do whatever you want. Make a little pitch. All right, yeah, you'll be top of the show. We'll kick it off, and that's what I'm talking about. Take that open mic. You never know. You only get one shot. If I knew that rap, I would do it. All right, we're still missing a few judges, so we'll wait for them to come back. Is everyone enjoying themselves? Yeah, it's a nice way to spend your Friday night. I hope you get some connections. Have you met anybody new, sir, today? You have. I don't know, I feel like you know her. Do you know this guy next to you? You do? Do you know him? Hey, you guys should talk real quick. You should check it out. I'm looking through your eyes. They said your liver and heart. I can also see if you're lying. This is also part of it. All right, Alex, if we could get the setup, they're getting plugged in so we can figure that out here. Nice. Let's make sure it's up there. That's good. All right, we are going to wait for our judges to come back. So let me introduce Green Shirt. Green Shirt, ladies and gentlemen. Put a golf clap together for Green Shirt. I put an open mic, and here he is. We're still stalling, waiting for some judges. Judges, you cannot vote for this person, okay? Green Shirt Brian. All right, let's lower the jazz music a little bit, although I like it. Actually, keep just a little bit on there. Yeah, that's right. Here we go. All right, ladies and gentlemen, Brian, I have no idea what he's going to say, but he's got something.
Yeah, interesting. I just threw this together. So living here in Orange County, I think we can all recognize that we're susceptible to wildfires. And this doesn't have anything to do with health, storytelling, or anything. Yeah, but you know, right. So wildfires are a part of living in Orange County. They're a part of living pretty much anywhere in the US, in the world really. And they seem to be getting worse. They're becoming a bigger and bigger problem. And I mean, personally, I've been evacuated in my house 3 or 4 times now. And it's a real pain. So I would love it if someone could put together an AI that could be paired with all the cameras that we already have out in the hills, out in the mountains. They're already aimed at the fire corridors. All we need to do is make them smarter so that they can spot that fire sooner, recognize that it's a fire and not some false alarm, and then alert the authorities and help all of us. So someone could still work on that.
What do you think? Do we like it? Yeah?
It would help me. It helped me a lot.
All right, so check this out. We got to build a team real quick. Do we have any students interested in helping with this? All right, over there. All right, so what's your specialty? All right, we got embedded system back-end guy over here. We need somebody in marketing. Who wants to market this thing? All right, we got to work on our marketing of the marketing. Ladies and gentlemen, business is all about solving problems. We agree fire's a problem, and the fact that this dude got up here to share it's a problem and he wants it to be solved deserves a solution. So let's figure it out. You got one team member. This is how it all starts. Give him a round of applause. Excellent job. Green Brian with the green microphone. Green for money. All right. Looks like we have all judges except for Tammy Kim, and we know she was making a little speech here. Calling Tammy Kim. Tammy Kim on aisle 3. Okay. We might just get going. She's going to peek in here. It's going to be totally fair. Are you guys ready? Yeah. All right. He's like, yep. You got your microphones ready? How's the audience doing? You got your food? Are you ready? You can just say yes. You don't have to clap. Are you ready? Yes. All right. Ladies and gentlemen, in our AI and storytelling, or AI and storytelling entertainment, this is a very special track because UCI is doing a lot of great things in AI, and they want to spark interest with our students around storytelling and entertainment when it comes to AI. How many people love stories? Right? We love to be entertained. Well, guess what? The future of storytelling and entertainment is changing as we know it. And so we had a number of submissions in this category. We have 6 that we're going to go through. Ladies and gentlemen, first up, Overshoot. Give them a round of applause. Timer on the clock. Confidence monitors over there. Ready, set, go.
All right. Hello, everyone. We are proud to present Overshoot, the world's first AI photography assistant. Now, before we get into our product, I want to ask you all 2 questions. Now, please raise your hand if you have ever taken a picture with your cell phone.
Definitely,
Right,
with Peter
sweet.
today.
All right, now, raise your hand if you've ever looked back onto a photo and realized Oh shoot, that picture did not turn out the way I expected.
Maybe.
It seems like everyone here, sweet. Now that there is the issue we are solving here today. Did you know that every day, 5 billion photos are taken with a smartphone, and each shot tells its own special story? However, we have found out that many photos are ruined by silly mistakes like blurry photos, finger blocking the lens, and people being cut out from the image. You might not see that guy. And these are just a few out of many mistakes that ruin photos, and this is an issue because in our culture today, pictures aren't just pictures. They're moments and experiences that we live only once in a lifetime. And with that, we are proud to present our solution, Overshoot. So, what is Overshoot? Overshoot, as I said, is an AI photography assistant, and it not only detects potential mistakes, but it also guides you to take better photos. Now, we're gonna go on to the demo, so here's to you, Paul.
Thank you, Josh. So let's just get started with our demo here. So I'm gonna take a picture of Josh right here.
I got you. Hold on.
Thank you so much. And we're gonna simulate a blink that we always see in pictures. So Josh, blink for us. And shoot. And here you can see that the AI actually recognized that he's blinked and tells me who it is. And it prompts you to retake.
And it's just that simple. Now, that was just one of many of our features, but we also do have finger detection, where when your finger does come into the frame, it actually alerts you that there is a finger in a frame, and it will address to you that you need to retake your photo. Now, we would love to share with you our community album, which our talented Paul will do for you.
Yes. Ever wanted to find cool photo spots or just mimic some shot you saw on the internet that's cool? Well, with our Maps feature, you can actually upload photos to our community album, and other users can actually use that data and use our AI models to replicate that photo exactly. But we also think that photos are not just shots frozen in time. That's why we have innovated a feature we call it Labs. So with Labs, users can upload those replicated photos onto our community album, and we can create something like the time lapse you see here on the screen. And it tells a story of a location changing over time. And this is truly dynamic storytelling with photography. Now, what's powering these features is a complex network of AI algorithms, and I would like to bring Nathan up to the stage to tell you all about it. Thanks, Paul.
All right. So what's the magic behind Overshoot? Well, this is all thanks to the powerful, deep, convolutional neural networks powering these features. And we've actually trained using over hundreds of thousands of images. So yes, in-house models. We're not using requests, we're not using GPT, in-house models locally on your device. And with that, we're actually able to achieve over 90% accuracy in our testing. But we do plan to increase this number further as we continue in our research and development. Now, you might be asking, why can't we just use stuff like Photoshop or AI editing software like Pixar? Well, you can, but there's some serious limitations. Number one, Photoshop has a very steep learning curve, and it has a huge paywall that makes editing photo very difficult for everyday users like you and me to edit their photos. Secondly, using AI to edit your photos loses the authenticity and the sentimental value of the photo. It's kind of weird if you have your family member AI generated into your Christmas card. It's just not the same. That's why Overshoot focuses on innovating at the moment of capture. Now back to Josh to explain the business.
So how do we generate revenue? Well, that is a great question. So users first start off with the free basic functionalities of Overshoot, but by opting into a premium monthly subscription, they will not only have access to these basic functionalities, but they'll get access to more advanced AI features like posing suggestions, composition matching, and color theory. And moving on, we also run a B2B business model as we allow local businesses to sponsor themselves on our maps. We're also exploring partnerships with e-commerce platforms dedicated to creating photo gifts. That way we can cherish our memories. And we plan to market this by storming in onto social media, run those ad campaigns, and also, contacting your favorite social media stars to vouch for our platform, which is, we want to target our target audience which is folks like me and you. Now, Nathan is here to tell our team introductions.
Right, so Overshoot is not just a moonshot. We actually have a very capable team that can bring forth the technical aspects of this application. So I'm an ML researcher. This is a very experienced UI UX designer, and here's a very talented full stack and ML engineer on our team.
Yeah, and with that, we are proud to announce the world's first ever AI photography assistant, as Overshoot Beta is now live on test flight. So, take out your phones and scan our QR codes. We're excited to see the stories you all will tell.
Woo! Lots of phones up. They can't clap because they gotta.
Thank you.
Stay there, stay there, stay there. All the judges are signing up right now.
Sweet.
If you're a judge, do you get a discount on your subscription? No, don't answer that. Don't answer that. All right. Yes, sir.
Great presentation. I'll ask you the same one I asked the other guys. So what is your competitive moat? How are you going to protect yourself against anyone else coming and doing the same thing?
Yeah, of course, that's a great question. I mean, any company with a lot of resources can copy what we do. However, we're gonna be investing into lawyers and getting this technology patented. That way, no one can steal our idea. Also, we're gonna be the first one, and no one remembers the second guy on the moon.
All right, give him a round of applause. Excellent work. Nice, nice. Let's get Ven Art up here to get set up. And judges, do me a favor. I want you to write on the top of your page real quick, make sure it says overshoot, not overshot, overshoot. Not moonshot, but overshoot. Write that up on the top, please. And then when you are done, we are going to collect them and we'll be adding along the way. We just get better all the time. Test, iterate, scale. All right, let's make sure we get set. Can we get a little music in the transition, please? And this is royalty-free music, that's why it's so good, because we're live streaming. Everybody say hi to all our fans on YouTube. We are live. Oh. This one goes out to all our YouTube subscribers, all 163 of them. You know, if you want to subscribe, we'll try to see if we can get a discount on these apps that are coming up here. All right. Royalty-free doesn't mean high energy, but we'll find it. It was good. It was good. I like the jazzy jazz. All right. Give it up for Stefani. All right. Judges did not give everything. It's okay. Give the judges a round of applause. This is intense. You guys are judging, but you're not having to do any work. All right, judges, please write down Ven Art at the top. Make sure you have it. Would you like to take the center stage? All right, we're going to bring a little energy back. We're going to do one clap all together, a thunder clap. Judges, they look like they're ready. You're positioning. They're not ready. Now they're ready. On your mark, on the count of three, one big clap together. Even you in the back. I actually can see you really well in the back, okay? Get your hands ready. 1, 2, 3. Wait a minute. We had some late clappers there. Restart the clock. Nice and loud. 1, 2, 3.
Good evening and happy Friday to you all. My name is Catherine.
I'm Elijah.
Mic check. Oh, I'm Henry.
And we are Ven Art, using AI technology to revolutionize the way we learn history and bring history to life. So have you ever dozed off while reading an intensive history textbook? I have. Many of us have. Here at Ven Art, though, we think that history can and should be fun. And that is why we designed Time Echo, to make learning history more exciting. Now, time for the stats. Researchers say that visual aids in the classroom improve learning by up to 200%. And 93% of our communication is visual. That is why we need to include more visual components in our curriculum to revolutionize the way we learn history.
Hold the mic close to your mouth. There you go.
And that is where we come in. Time Echo is a platform that produces AI-generated, hyper-realistic historical avatars that we can interact with in real time. Say goodbye to simply reading about former President John F. Kennedy. Now we can hit him up anytime we want, like an old friend. This isn't just your typical chatbot. We're talking meta-humans with a wealth of historical knowledge that can bring the past to life. So think about the impact we can have. By making the appeal of history more appealing to everybody and making learning more personalized, we can produce a generation of more informed citizens. So making learning more engaging in the classroom, that means better grades, better performances for our schools, better reputation, and ultimately we produce a greater generation of informed voters and higher civic involvement.
Now, I'm sure you'd like to see a demo. So I'm going to invite my friend. I'm going to invite my friend. Can I borrow you? Hello. I'm going to invite my friend, JFK. Here, use mine. It never failed. Let's failure. Hello? Hello? Okay, perfect. Now, hello, Mr. President.
Well, combating the threat of communism while upholding personal freedoms has always been a delicate balance.
Everyone close your eyes. You didn't see any of that. Close your eyes, just for 1 second. Or just focus on me. Look right here. Hello, Mr. President.
Good day. How may I assist you today?
Well, I was wondering, how did you juggle defending American personal freedoms with combating communism abroad?
Well, combating the threat of communism while upholding personal freedoms has always been a delicate balance. My administration sought to address these challenges with a combination of military readiness, diplomatic efforts, and international alliances, as embodied in our actions during the Cuban Missile Crisis, our support of the United Nations, and my establishing of the Peace Corps. And son, throw away those note cards. Speak from your heart.
Now, that was just a prototype. But how does it work? Well, first, we use historical documents to create the basis for our character. Then we use archival audio to create the speech. And finally, archival footage to create the lip syncing like you just saw. And it's all AI powered. And that's really at the core of what makes our product so unique. Every part of our process is driven by highly innovative, cutting-edge artificial intelligence technology. And we use historical documents to give you credible, realistic responses like you just saw with Mr. JFK. But it's not just about John F. Kennedy or anybody large. And our product can and will be applied to common folk throughout history. So you'll be able to talk to a Chinese railroad worker or a mother from the Great Depression. And that's because our product is aimed to give you access to the rich tapestry of our shared human past. That's where you all come in, to help us on this journey.
But judges, we know why you're here.
For the record, they're not designing microphones, just for the record. Okay, good. It should be green. How about, I know, just step, oh.
That fixed it.
Test. Let's talk about markets. Our target market will be introducing Time Echo to private schools and public schools across America. And as we gain more attention and further develop our product, introduce that to other educational centers such as museums. Now, we understand that there are already established educational aids in place. Things like Khan Academy and YouTube offer traditional lectures, and some even newer applications like Hello History offer AI-generated text-based historical conversations. However, with our use of multimodality features combining both voice and video, creating an audio visualization in the classroom, we can further engage students. Give me a second. We can further engage students. We can quite literally bring these historical figures to life.
Short time.
Sorry. And
you got it. Give him a round of applause. He's going to finish strong. You got this. Finish strong.
give me a second here. Not only talking to famous historical figures and learning through conversations, but also through learning about marginalized groups, people whose stories in history may have been overlooked. And that's what separates us from the competition. Now, for our marketing plan, what we plan to do is at first partner with historical associations like the American Historical Association and use their oversights and their validated documents to ensure historical accuracy of our product. Next, we will market to private schools as a...
Our product is meant to bring history to life, and that's what we hope to do today, and that's what we hope to do in the future. Thank you.
Time, perfect timing, excellent. Good job, everybody, good job. All right, a little bit of music maestro in this. You did it. I told you stuff is going to go wrong, but it's not about going wrong, it's about how you deal with it. Right, judges? Mm-hmm, yes, yes. What question would you like to ask? Not tech related. Eugene, you're up.
What would be the revenue model?
The revenue plan?
Yeah, revenue plan.
And students, don't touch the buttons on the microphone. They should work. There we go. Okay, this is good. Yeah, this is good.
Yeah, so our economic model serves to focus on schools and individuals. So first we're going to target private high schools and universities, and then sell to them, and then after that open it to the general public so that anybody could have access to our model, our app and our platform.
And before we even get started, we're going to be receiving or applying for federal grants and California state grants that help with the education of our state schools.
All right, I know they want to ask more, but that wouldn't be fair. Give them a round of applause. You guys are out of here. Put the mics down on the table. All right, let's get Vango Art up here. Now's the time for the music cue. Let's get some jazzy jazz fresh. Next transition, Alex. We got to find some copyright, non-copyright that's a little more upbeat. We're feeling it, but we'll step it up a notch. Go. Good. Yeah, don't press the mic. Good to go. There we go. Friday dance party.
Hello.
Peter's dancing.
Hello.
Do we have a mic? Test your mic. Make sure your mic works.
Test.
Okay.
Test.
Okay, there's real time. They're monitoring, so it should be all right. All right. SCP. All right, are you ready? Let's slowly slide the music out. Let's slowly slide our attention to the stage. And on the count of 3, you're not going to do anything. This is a silent start. Ready? Don't do anything on the count of 3. 1, 2, don't do anything. 3. Go!
Good evening. We are
Vango.ai. Transforming digital marketing, one story at a time. This is Serena. She never has the time or resources to share her small business's story or brand. She spends all of her time on operations and logistics, but she is desperate to improve her digital presence, increase her customer base, and improve sales.
Your story is your brand. Customers are driven towards your story. It is what drives you day in and day out to make your business a success. It is also what differentiates you from your competitors. We believe that strong stories deserve strong brands.
Small businesses are ran by small teams, and typically they lack the manpower to have social markets. Small businesses are ran by small teams, and typically they lack digital marketing. It takes one person up to a year to master digital marketing completely to be able to
You got it, buddy.
It takes a small business owner up to a year to completely learn about digital marketing. Alternatively, it can cost up to $45,000 annually for them to outsource these services elsewhere. Research has shown that 93% of small businesses struggle even with the most common social media problems. Additionally, 73% struggle with conducting market research, and they struggle with they struggle with their marketing research, and they struggle with gaining traction through digital channels. So our solution, Vango.ai, an online platform where small businesses are able to generate an endless amount of generated digital content.
So how does Vango.ai work? Well, as Daniel mentioned, in 4 simple steps, we're able to create an endless stream of digital marketing content for you. Starting with step 1, your company. Simply input the name of your company and proceed to step 2, your story. Tell us more about what industry you're in. What are your main products, your main services, your main offerings? Who are your intended customers? And then follow along to step 3, your purpose. What is the purpose of your digital marketing content? Who is your target audience? What digital channels do you care to employ? What are your primary and secondary colors that you want to integrate into your marketing material? And finally, step 4, your content. Like what you see? Simply give it a heart and download it. Don't like what you see? Simply press regenerate.
So here at Van Gogh, our target market is comprised of small businesses, specifically under the realm of $200,000 in revenue per year, entrepreneurs and creators. Now, as we look into our market size, we specifically focus on the group that is actively invested in marketing content for their brand in a strictly B2C environment. Now, our annual contract value is $100, leading to a substantial market size. Here at Vango, we offer 3 different pricing models. Our base plan is intended for those who want to test out the platform with a limited set of features, and the pro version is intended for solopreneurs, freelancers, and bootstrap businesses. And finally, our business tier is meant for funded businesses, agencies, and those with needs for higher branded content.
So our product stands out using generative AI as a smart solution. We also have unique features, including a brand personality test, unlimited customization, image recognition, sentiment analysis, and performance analytics, giving us an edge over our competitors in today's dynamic market.
Now let's get into the impact of Van Gogh. Enhanced efficiency. Our platform streamlines content creation, saving time and resources for each and every small business out there. Personalized engagement. Our AI algorithm ensures that the needs of a specific target audience are met, increasing rates of connection and engagement. And finally, cost-effective scalability. Our automation reduces the need for human resources and interaction, allowing businesses to scale in an upward fashion in an efficient manner.
My name is Daniel Yee. I specialize in tech and software engineering.
My name is Jay Hathiramani, and I specialize in finances.
My name is Shreya Mawandia, and I specialize in operations.
My name is Claire Wu, and I specialize in research. And we are
Vango.ai.
Transforming digital marketing,
one story at a time.
Yeah.
Thank you. Any questions?
I have a question.
Yes, Mia.
So this is an interesting idea. I wanted to find out what started the idea, what kicked it off.
Of course. So this idea actually generates. This
You've been
idea was
using
founded-
ChatGPT too much.
This idea was founded when we were reflecting on our own lives and the struggles that our families have faced, and actually a lot of our parents have small businesses of themselves. So me specifically, my mother ran an olive oil company, which she started during the COVID-19 pandemic. And I realized that she really struggled with creating marketing content, especially for something as simple as Instagram, because she doesn't have the experience with Canva, Photoshop, Illustrator, anything of that sort, right? And she was sacrificing hours she could have been spending, making contracts or logistical details, importing, all of those sorts of things, spending 3 or 4 hours to make one simple poster. So we really wanted to streamline that process for small business owners, such as her and like the thousands of mom and pop shops that are existing in our current world.
Excellent, thank you.
All right, bleeding heart clapping for that. Saving mom. I love it. All right. Excellent, excellent. Let's get our Kova up. Kova, come on up. Yeah, a little bit more jazzy. That's cool. Turn it up, Alec. No, just set it down. get you that the lights are bright in your face, right? But each time they're in your face, it's a little bit better. Tammy's had lights in her face for a long time. She doesn't care about the lights. What lights? All right. Yes, leave them on the whole time. They're on already. Green means good to go. All right, grab them, get on center stage. You got a clicker? Here's a clicker. Who's in charge? These judges are having too much fun up here. I love it. Woo, judges. Judges are rowdier than the audience. Don't worry, they can't turn around and judge you. They're busy. All right, let's turn down the music. Let's turn up the applause. This is a no structure applause. You can freestyle. You can get whatever you want. Oh, yeah, that's good. All right, and action.
Happy New Year's, ladies and gentlemen. Your presence here today is a testament to your curiosity and belief in a better tomorrow. Many of you ambitious people have created New Year's resolutions. However, many of you have already failed or will never reach them. Did you know that of the entire US population, only 4% actually accomplish their resolutions?
This isn't just a New Year's resolution problem. This is our tragic reality. We live in a world with more access to data and resources than ever before. Yet according to research, only 10% of people who set goals actually achieve them. However, this number skyrockets to 95% when people connect with accountability partners.
This is where Kova comes in. There are 3 ways Kova helps you reach your goals. To put it simply, we believe that AI plus accountability equals success. Let's take a closer look at these 3 areas.
Kova connects people. The Kova journey begins with creating a simple profile, capturing data such as age, location, and a goal. Kova's AI will then enforce a density-based clustering algorithm, which will match users based upon their profile, based upon their goal, and then on profile compatibility. User identification will be required in order to maximize security and authenticity, because safety is one of our top priorities when forming accountability groups. This system will lay as the foundation for long-term success and accountable connections.
Kova fills in the blanks. Once you have joined a group, Kova will create your group using AI that recognizes patterns in user data, internet reviews, and the historical stories of successful figures. To see how Kova works, let's look at the example of losing weight. Don't know where to start? Don't worry. Kova has 3 essential tools that will help you stay on top of your goal. The first is an optimized schedule that recommends daily and monthly tasks, allowing you to take the small steps to finish your goal. The second is a goal ecosystem or home base, compiling resources that would be tedious to find otherwise, such as gyms to go to, classes to take, or dietary plans. The third thing is flexibility, as Kova can recommend curated plans that are just for you in price point and intensity, maximizing group and individual needs.
But Kova is not just about losing weight. There are countless use cases that exist. With Kova, you can take scuba diving training, get your real estate license, set aside time with your family, build your own startup, climb Mount Everest, travel the world, or even sample small hole-in-the-wall Chinese restaurants on the weekends with your friends. Our technology provides the steps for you to reach your goals, big or small, in a trackable and personalized way, organizing all of the chaos of our lives into a single platform. Kova forges the future, and now that you're equipped with a roadmap, it's time to start achieving your goal. Imagine your city transformed into a world of endless possibilities. You and your friends become characters, traversing this new ecosystem and achieving goals together. Within your accountability groups, you can now encourage and motivate each other throughout your journeys. Someone struggling on their goal, send each other a fired-up motivational notification message. Or want to track each other's progress and see who's been working hard? Look at each other's completed milestones and pictures throughout the app. And once all of your journey is complete, you can step back and reflect on your photos and your stories through a timeless photo scrapbook, a collection of unforgettable memories. It's time to tell your story.
So, what is Kova's market potential? I'll give you a hint. It's massive. The global AI market is currently valued at a staggering $538 billion, growing rapidly at a compound annual rate of 19%. Within the $76 billion US AI services market, we believe we can capture $1 billion within 5 years, conservatively estimated based on US Census data and companies with similar revenue models. But how will Kova make money? Kova will generate revenue through advertising and partnerships. We eliminate the guesswork in advertising, perfectly pairing helpful products to group needs. Additionally, we'll partner with local businesses to assist users in reaching their goals. Our target market is US adults ages 18 to 40. This demographic has the highest AI adoption rates, and about 83% use at least one form of social media. To take Kova to market, we'll first start by running beta tests, addressing all major bugs and issues. Then we'll publicly release the app. Kova will be free to use, and referral incentives will be offered to initially drive user downloads. As users begin to accomplish their goals and spread their success stories all over social media, Kova's natural product market fit will captivate the nation, penetrating new markets and establishing strategic alliances with key companies.
We are prepared and ready to see this project to its completion. In order to do so, we have initiated conversations with UI/UX designers and software developers, but we will need investor funding in order to officially assemble this team. So we leave you with this. How will you achieve your goals? Thank you.
Well, if the goal was to give a pitch, you crushed it. Goal achieved. Judges. Who wants to be judgy right now? Oh, they're writing love notes, so let's give them a second. Okay, yes, sir. There you go again.
Yeah, as a social app, there should be some interesting opportunities for network effects. So maybe talk a little bit about the network effects you expect to go build into your application.
Network effects as in connecting with businesses or people connecting with people?
So a network effect is when every person who begins to adopt your product makes your product more valuable to the next person who wants to adopt it, which increases the value of your product the bigger and bigger it grows. Think of like Facebook, for example.
Like when everybody follows us on YouTube, and then they share with their friends, and their friends share with their friends. The next thing you know, we have tons of YouTube.
Yeah, so as I said, there's going to be a referral incentive system initially just to drive new user downloads. And then as users will accomplish their goals, they'll likely spread their success stories through social media, right? And then that will lead to what is it called?
Word of mouth.
Word of mouth, thank you. Word of mouth referrals to other people. And then, yeah, our app will seamlessly transition to other social medias as well. And then, yeah, there's so much value in seeing real progress and connections built on growth rather than superficial likes and just fake things.
And yeah, one of our main steps, or one of the main reasons we created this, we visualize this app is because we feel that a lot of social media nowadays, it can be very superficial or not authentic, or people just post things to get likes or not really be themselves. And so these groups that we're creating are to create groups.
Hold the mic close. Close.
So there's accountability and also just encouragement between group members. And yeah, that's one of the main reasons why we envision this.
All right, crushing goals in the new year. Give them a
Thank
round of
you.
applause.
Thank you
Good
for that
job,
question.
gentlemen. Put your mics down. Nice. All right. Now, I always like to keep typos around just to keep us on our toes. And so there is a typo up here on the board. And if anybody would like to guess where the typo is for our next challenger here, some may think it's feel fram, and it's not. It's actually feel frame. So please, judges, write that at the top of your thing. Feel frame, not feel fram. Because feel fram is probably a scam that's trying to leverage brand halo. Feel frame. All right, everyone got their microphone?
Oh.
Good, good. You got the clicker, you're there. You're feeling good? Make sure you're in frame. All right. Do you need a microphone? Here, take mine.
Is this on?
Hello, everyone, and good evening. We are Feel Frame. Oops. this on? Sorry for the...
Okay, all quiet on set. Take two. Run the roll. Rolling. And you want to check it? No. Take three. All quiet. Set. Camera rolling. I have no idea if this has to do with film. And
Check it, please. Check it.
okay.
Okay.
Let's move the. All right. Take 293. Ready, frame, fill, and everyone claps for the action clapper. Run, two, go.
Okay. Hello, everyone, and good evening. We are Field Frame. Our team consists of 5 undergraduate students at UCI. We have myself, Lucas, Min, Juwon, and Chris.
So I would like to start making a question for all of you. How many of you guys have ever taken a survey online, either by YouTube asking you to complete the survey or Netflix, and you lied on it? Raise your hand if you ever done that. Raise your hand. So that's what Field Frame is all about. So we come to realize that there are so many surveys in our daily lives, such as the ones YouTube, Netflix, and UCI included the end of quarter surveys, and nobody really takes it seriously, right? So they're not accurate and they're time consuming as well. And because of that, we decided to focus initially on UCI, the end of quarter survey on UCI. And out of 20 students that we interviewed, only one said that they take the surveys voluntarily and accurately. So this is a really bad number, right? Yeah. And our big question is, how can we fix this problem?
Right, so here's our solution. We use computer vision with machine learning to label and detect every single person's emotion expressions. So this is how we started. As you see here, our program detects everybody's face, even eye, nose, and lips. So it just shows you the face structure. So you might wonder how Field Frame works. Field Frame work, we have our own model, and then we have our own custom data set. So we train our model, and then it will detect every single face's emotion, and then attention levels such as awakeness, drowsiness, or distraction. And it's gonna generate the score. For the simple example about the score, if someone is looking at the screen, and then he lose his attention on the screen, then the program will capture how many frames he lose his attention on the screen, and then put this one into the total number of the frame, and then with the coefficient. That's how we calculate the score. This score is really important because this is the key factor when we're evaluating the quality of the service, such as a lecture. So this is Field Frame's uniqueness. If you search on the Google, you can find there's so many AI models can detect emotions or even the attentionness level. But in Field Frame, extend that capability. Based on the collecting data, our program generates the feedback, and this feedback is eventually replace the survey that we usually take traditionally.
So when talking in terms of marketing perspective, we do believe that Field Frame has a great potential. So our initial target customers will be universities. So during our first step, we'll start with UCI, and we'd like to address the problem of inefficient evaluation process that we discussed before. And our model will be deployed in real time, and they will be used in the lectures and throughout the recorded lecture videos and also the online classes. But the question here is that are universities willing to pay for our technology? So here's a simple answer. So this is the expected market size for AI in education for 2027, and then $15 billion are waiting for us. So as you can see, based on the data, there's an increasing market size for AI in education, and also the UIUC has secured significant amount of money for AI to improve students' learning experience, which Field Frame is also aiming for. at this stage. At the same time, when looking at the similar fashion businesses like Turnitin and Pearson, which relies on their AI tools as well, they're earning millions and billions of dollars from their business. So in overall, we have good reasons here to say that our business model, FieldFrame, is viable and profitable.
Okay, but we're not stopping at just serving universities and university students. We will also expand FieldFrame to other areas as we increase our profit. So let me introduce you to step 2 and 3 of FieldFrame. During step 2, we will deploy the model with larger corporations, any corporations or companies that require an employee training system. So if you really think about it, any companies would need that. FieldFrame will, based on instructions and data given by our customer company, and it will generate an interactive lesson. That lesson could be either a video or a podcast or any visual element of instruction to train the newly hired employees at the customer company. And FieldFrame will test that those employees based on their understanding and comprehension of the materials, and it will reflect the results back to our customers. So that will be step 2. Step 3, okay, got it. FieldFrame will expand to industry-leading companies, any companies that require a manufacturing or maintenance process, and ensure those processes run well. So FieldFrame will use is AI detection technology to detect faulty components or elements during the maintenance/manufacturing processes. So to summarize everything we talked about today, we start with university as our crucial stepping stone for moving towards larger corporations. And in order to have a self-trained model, which we will use for our step 3, to execute that model with larger companies. And that would be our final destination. Yeah, this is where we got our data from. And thank you for listening.
Hi, thank you for your pitch. So one of the inherent problems with student evaluations is that implicit bias becomes a major component of how students react to professors, instructors. How can you help negate the implicit bias issues?
Sorry, can you explain that again?
So implicit bias, right? So the bias is, whether it is based off of gender, race, anything, right? That there's within most student evaluations, the biggest problem is that, for instance, if you take the exact same class and you say that's online, and you say say it's taught by a man versus taught by a woman, without ever meeting the instructor, the students will automatically, they've shown, will rate the male instructor higher. And so that's a kind of implicit bias. And so if you're especially seeing that within emotions from people face-to-face with the computer, how do you help train the AI to negate the implicit bias?
I think I can answer it. So for the bias, we can train like a model with a, with a different model for them, as what you said, like a male and a female. And then we test everything, and then what we plan for the substitute survey is like we're gonna make up all of the single question about the survey, because like a survey has a certain kind of format. So we're not gonna destroy that format. We will keep that format, and then we use the score in order to answer that every single question on the survey. So I think we have to we have to develop the functions to measure the scores, everything, like as what you say, to take care of the bias, and yeah, and then I can deploy like a bunch of models to see which one fit for each individual, and then each classes, or for those certain kind of major and kind of stuff. Yeah.
All right, nice. I like these like implicit bias. I'll just fix it. We'll program. We'll figure it out, right? There are a lot of challenges with this new technology, so I appreciate these hard questions because in order to get to that next step, sometimes we don't know what we don't know. And that is how we can all help each other out. So if you see something, say something. Let's get our vision board up here. Come on up. Let's get set up. Yeah, they're clapping for you to get set up already. All right, let's get you there. Yes, it's going to be... Alex, can we get some upbeat? Sorry. Oh, he likes relaxing for this one. His is good, but next one. Let's get it. All right. Yeah, you gotta plug it in. Nobody's looking at you. Don't worry about it. There's no pressure. They're all looking over there. Now they're looking at you. All right, here you go. Your clicker's gonna be, let's make sure we click that. Clicker's gonna be here. All right, center stage so that there's something shining in your face. Okay, center stage. Okay, keep going. That's not center. Good, a little bit more that way. A little bit more that way. Okay, up a little. Okay, back a little. I'm just kidding. All right, hey! All right, big round of applause for our last but not least vision board in the storytelling entertainment track.
Hello, everyone. We are Vision Board, and we are all about merging the physical and digital worlds. So what is Vision Board? Vision Board is a technology that seamlessly connects physical board games with digital devices, expanding game makers and players' storytelling capabilities. But first, a little bit about us. I'm representing our team today. I'm Derek Yazan. I am the creative lead and the business strategist. My major is computer science, and some experience I have is I was the founder of Board Game Club at my previous institution, and I'm a member of the Themed Entertainment Association. And then two of my members are Sausen Khan and Jaden Ark. Sausen is the lead AI specialist, and Jaden Ark is a computer science major who specializes in game development. Okay, so why mix board games and technology? So according to Fortune Business Insights, the global games market is $11.88 billion in 2022 and is growing to be $26.04 billion in 2030. And with this new technology, there are many new types of integrations, including AR technology, apps, and fully digital video games. However, some downfalls with these technologies is that they remove you from the immersive experience. So for example, a game might require you to play the board game and then pick up an iPad. And that means that you're no longer focusing on the board game, but rather focusing on inputting data, which is taking you straight out of the story. So our innovative idea. So we're using an AI camera to scan what happens on the board so that you can focus on the game itself, and you never have to worry about inputting information. So how this works is we're gonna have a physical board game and all of the tools required. So dice, cards, tokens, etc. And then we have a camera with an AI-equipped device and a display or speaker. So how it works is that the AI scans the board and sends information to the computer, which can keep track of everything that's going on in real time, and then do really neat stuff, including these innovative applications. We have a bunch of these, so I'm gonna try to get through them as fast as possible. So we have visual audio effects. Oh, actually, I'm just gonna go, there you go. Visual and audio effects. So this is the first one that I think will be the most impressive and most entertaining. So this is, we can have visual effects apply in real time as you play a board game. This is really important, especially for people who might be less imaginative. For example, if you're playing with your parents or grandparents and you're like, there's a dragon right there, and they're like, there's no dragon there. With this technology, as soon as you step into a tile, a dragon can pop up on the TV screen, and that's like totally immersive. And you can do the exact same thing with audio. This is also really important when playing with family. The worst thing is when you get a new board game and there's 23 pages of rules and it's like size 6 fonts and you have to flip through it while you're playing. So this can teach you the rules and help you follow the rules. This is especially important for people or families who have cheaters. My dad often cheats in board games, so this technology can keep track of everyone and make sure that people aren't sneaking. Yeah, they're not sneaking an extra $100 in Monopoly. And then new gameplay dynamics. So with this technology, it means that you can add computer-controlled players into the game. And so that means that you could possibly play a game by yourself and with a computer, or you and five of your friends could battle against, for example, a dragon, or search a mansion for ghosts that are controlled by the computer. We can also support live updates. So once you buy a board game, it doesn't mean that's it. They can add new things to the board games, and this could be shown through DLCs, cosmetics, and battle passes. And then we can also have multiple device games. So if you do want to have that more connected device experience, you can do that through this game. And then guided story games. So basically you can play a game that you've never learned before, and the game can guide you through an entire storyline. And then finally, this is the one that I'm most excited for. It's a tool for people who play Dungeons and Dragons. So basically this helps people, I hear some clapping back there. It's a tool for dungeon masters so that they can make experiences automated so that they can pre-plan these stories and make storytelling even better. And then impact potential. So this is a new type of technology, so it'll be different from all types of board games. There's many applications from simple games to more involved games. I'm going to skip ahead. Technical feasibility. So I had a demo. We used Easy OCR, which is a text reading application, but we want to move to more advanced technology. And then financial profits. Since we use less pieces, it could require less costs in producing them. Licensing games, we could work with existing companies so that if a company already has a board game, we can make a digital version that works with them. So if you have a board game at home, you can just download an app and you have new options for that game that you already own. And then virtual updates such as DLCs. Thank you for watching or listening.
All right. No, you're still front and center, buddy. The game is not over. The game is not over. And John Pratt back was like, you need this because I bet you cheat in Monopoly. That's what I heard his words saying. All right.
So,
questions?
Yeah.
Yeah, Lewis.
So I'm wondering, when you were thinking this out, did you have a sort of a narrow set of games in mind, like Dungeons and Dragons, or how would you account for the variability, extreme variability in board games? Because they can either be like Uno.
Hold the mic close, bro. Closer.
Where it's where the game is numeric based and somewhat visual, or it could be Risk, where it's a lot of pieces and things like that. So how could have you given any thought to whether or not you go narrow or broad in terms of the games that you'd like to target first?
Yeah, so what I was thinking is we build out this as a tool, so the tool can be applied to many different games. Honestly, I was first inspired by the game Mario Party, which is basically a board game digitally, and I was trying to reverse that. And so that's a very traditional board game in the sense that you move like in a line, kind of like the game of life. But this definitely can be applied to a bunch of different board games. Because the AI vision software can become more advanced with more 3D models that can track 3D objects, it could track anything that you put onto a table. And so it's more of a tool to track things that are going on, and that tool can be applied to a bunch of different games, existing games or new games that you want to add. Yeah.
Boom, all right, nice job. There officially is a dragon. Excellent, excellent work. All right, that's our AI storytelling and entertainment. Super exciting for that as a track. Now, judges, make sure the name is on it, and Steph is going to come and collect. And we are going to move to the next. We're just moving through. We started a little bit late. We had some technical glitches, but we are fighting for this and fighting through. If you do need to take a bio break, feel free to. All right, let's get our next person set up here. Zot Sites. Let's give a big round of applause for all of our storytelling and entertainment track. Yeah. We're just down to the last 5. Here we go. Oh, remember, if you were part of the track and didn't make it up here on the big stage, it doesn't mean that you won't be on another stage, because there's the New Venture competition. There's the Beal Butterworth competition. There's the James Holt competition. There's the Dyson competition. There's probably another competition. And then another competition. And maybe next year competition. Does anybody want to take a guess at how many different tries it took James Dyson to get the right vacuum? It was over 5,000 iterations of the vacuum before it came true. Totally legit. Like, this is version 1, 2, 3, 4. Talk to me when you've got 5,000 more. All right? It's what? Oh, that's because if you have an HDMI, you need this to be in the HDMI. And then this to be over there. Sweet. Oh, who's the tech pro now? These guys just code circles around me, and I just totally fixed their problem right there. All right. Everybody stand up. Don't worry, sit right back down. This is good for your, like, my iPhone would tell me to stand up if I sat as long as you did. So just stand up. It's okay. Yeah, you can test. They're just standing. Good. Get a little, yeah. Yeah, who flew back from Vegas today but got yoga in the morning? Yeah.
Test.
All right. Hey, you don't have to eat the mic. Okay. No, don't push it. It should be on. Should
Hello?
be on. There we go. All right. Sit down. Get ready because we got 5 teams left.
No.
Uh-oh, they're arguing already. Founder
Test.
problems.
Hold on.
Testing. There you go.
There we go.
All right, you got your clicker? You ready to go? Ladies and gentlemen, this is the most submitted to track, the most popular track in the competition, and it's about student experience, and that makes sense. We challenged students to come up with a way to improve the student experience using AI, and here is your first of 5 that the judges will decide. Somebody's going to step home with a $10,000 check, somebody's going to step home with a $5,000 check, somebody's going to get a $2,000 check, and everybody else will just be like, damn! But you know what? I've gotten 2nd, 3rd, 4th, 5th place in a lot of things. 1st, 2nd, 3rd, sometimes they get complacent because they're like, we won, we're good, and everybody else is like, we need to work harder. We need to do this, we need to come back. So some people are going to win, some people are going to lose, but the future is up to you. Put your hands together, 5 minutes on the clock, clap it up. Last track, here we go! Action.
Thank you. Now let me begin my pitch by asking you all a question, whether you're current students or have been students before. How many of you use your phone daily? This isn't a trick question, guys. I expect all your hands up. Now, how many of you have looked for resources or events online, like RSVPing for this event on campus groups? Everyone should have their hands up or apologize to Ryan right now.
Thank you.
And now, how many of you found this hard, tedious, sometimes giving up, or missing the event altogether? Now, let me present to you 3 solutions that could solve just that. A revolutionary search service that is tailored to student needs. An easily accessible local news platform. And an efficient student support service directing students to the resources they requested. A revolutionary student search service, an easily accessible local news platform, and an effective student support service. Now, these aren't 3 different solutions because we made it into just one.
Introducing Zot Sites, revolutionizing students' online experience. The problem is that students just can't find what they're looking for, be that events, clubs, or groups on campus that they want to be a part of. This leads to feelings of loneliness and being disconnected from campus life.
The current structure is that event coordinators, like clubs and organizations, post their events on campus groups and then promote it on social medias like Instagram, where they hope the student at least follows their account or pops up on their Explore page. Why do we rely so much on hope and chance for students to access these resources on campus? That's where Zot Sites come in. We find the events for you in an easy and intuitive way.
We provide an online hub that offers specialized search services to all university students.
The current product is that imagine you're a student looking for innovation on campus. Now, I have this preloaded, but I wouldn't know too much about the AI Innovation Challenge, but I'd probably search up something like, oh, geez. I'd probably search up something like innovation. But here you get stuck with results like the definition, pictures. These solve what innovation is, but this isn't what a student wants. Now, if we go on Zot Sites and search up innovation, I click enter, and would you look at that? The AI Innovation Challenge Finals. And if you click on the link,
Damn, Skippy, that looks good right at the top.
the AI Innovation Challenge linked directly to the campus group site.
Normal search engines like Google and Bing provide you a horizontal search. This means they have tons of data that are marginally related through keywords but aren't specific at all. We, however, use vertical search by taking all the UCI-specific sites and gathering the semantic meaning of those websites. We're able to provide exactly what students are looking for. We don't collect any student data. This means no usernames, no passwords, no phone numbers, no emails, no nothing. The only thing we keep track of are the searches and clicks that students did while using Zot Sites. Taking this data and passing it through our machine learning model, we're able to see trends in real time and change results based on what students are actually looking for.
The current resources that students are provided are like Google, Bing, ChatGPT, which are oversaturated with their data, but they're easy to use, still leaving students with questions unanswered. Then university-provided resources like Canvas and campus groups have university-specific data, but students can agree with me here. They're very tedious to use at sometimes. That's what makes Zot Sites so important. We have university-specific data, and we make it to students in an easy and intuitive way.
After establishing a base at UCI, we plan to expand to other UC campuses. With the global search market predicted to double by the year 2031, we are looking for partners and mentors to make this happen.
Oh, and after deploying on this Monday, students already love us. With over 500 searches, we've had results like search queries like classes, clubs on campus, innovation, and more, but innovation might be David and I practicing for this pitch, I'm not gonna lie. In addition, our team doesn't fall short of meeting our ambitions as well. Hi, I'm Arjun, studying math here at UCI. I'm also part of the Office of President at the ASUCI. Just last night, I was presenting in front of clubs on campus as part of the Student Programming Funding Board. In addition, I built KhaledGPT, a ChatGPT derivative built on popular DJ Khaled quotes.
I'm David Kulchar. I'm a computer science and engineering student here at UCI with a focus on embedded computing, and I'm currently working on the back end for Zot Sites.
And our marketing and outreach intern, who's in the School of Humanities, Manat Bawa.
Two features we plan to add in the future would be a chatbot trained on the same data we train our ML model on to answer student-specific questions, and a calendar where event coordinators can send us the events or update their website, and we will add them to a campus-wide page.
That, ladies and gentlemen, is Zot Sites. Be connected, really.
Woo! Way to kick it off. All right, center stage, center stage. Do not put your microphones down.
Oh, questions.
Yes, this is like a vertical question where they're going to ask you one.
Oh, what's your business model?
That is something that we're trying to work on. The current model has two revenue streams. We understand that the UC campuses have a budget cut, so this is where something that we want to work with a mentor or a partner where we can access and network with these UC campuses, and also we collect anonymized search data, so we have search trends. We know what students are clicking, we know what students want, and 18 to 34 is the ideal age for advertisers, so why not tell them what students want?
It really makes sense for campuses to use something like Zot Sites because getting rid of legacy systems like campus groups or Canvas or WebReg here is really costly when instead you could just put another layer on top of that that'll bring them all together and renew them, give them some new life.
All right, well done, gentlemen, to kick it off. All right, put your microphones down there. Let's get Wellness U up here, or you, it's from the back, you're good there? All right, so come on up and we're gonna put this in. And I like it, Alex. This is more upbeat. This is good. Here you go. Yep, microphone 1, microphone 2. Okay, they have a video, so I assume you're not on mute. He's good. Let's see. Should be working. That made a noise. There we go. And do you guys realize how technical those last two words are? Like, we're studying this, integration, that. I was the one who helped them hook up their computer. I just want to say. All right, front center, stand away from this. Stand away from this. If you need confidence, you look up there.
Sure.
Further away from the podium is better for everybody. All right, scoot up a little bit. Scooting in is, this is good. Okay, are you ready?
Yeah, I'll just test. Yeah.
Yes. Remember, don't eat the microphone, but also don't have it down here. You should hear yourself. All right, you ready for number 2? Cell phones are up. Clap them up. Let's get it going. All right, and action.
Here are the two worlds of a student's journey on campus: the bright exit on the right and the dark exit on the left. In 2022, I happen to be on the dark exit on the left.
Microphone.
With my journey at UCLA. Certainly glorious from outside with all the awards and recognitions, but tormenting from within. And trust me, I wasn't alone. My research on college dropouts revealed a startling truth. Students struggling everywhere. And that's why this isn't just a competition pitch for us. We are here to solve a problem that we deeply resonate with. Hi, I'm Avantika Singh. I spend my days designing AI chips and hardware. Sorry. And I'm joined by Neil, an AI specialized computer science graduate student, along with Ishika and Ahmed. And our pool of mentors, we present before you Wellness U. Leveraging AI and data analytics, we are pioneering a transformation in university wellness culture, creating a brighter academic future.
University students face a critical well-being crisis. This affects the students adversely. And how about the campus resource centers? They are constantly under pressure. And how about the university? They take a hit in their revenue generation potential because overall rankings suffer. In fact, student well-being related metrics weigh a staggering 54% in the university ranking evaluations.
And so, we present before you Wellness U, bridging students with campus resource centers. We offer 4 key features. We quantify wellness quotient of a student. We offer data analytics insight to the campus resource centers using a dashboard. We also offer AI fueled by predictive analytics and the AI curated support groups for students. So, using a rated self-reported questionnaire, we quantify the wellness quotient of a student across 9 dimensions, backed by academic research. By integrating demographic data of the students, we uncover wellness patterns across the demography and assist the campus resource centers. Here is the data analytics dashboard, which are provided to the campus resource centers. Sorry, can you play that video?
Everybody pause.
Step into Wellness U's dashboard. We spotlight Emily Mitchell, a sample case study in student well-being. On selecting her name, instantly her demographic details are drawn along with records for 19 other students who share Emily's demographic background. The dashboard's heat map reveals her well-being in real time, contrasting personal score with demographic cohort averages across the 9 wellness dimensions and the resource awareness factor. For Emily, we see physical and financial well-being are lacking, but creative and social expression thrive. This granular insight allows the counseling team to strategically support Emily.
We also leverage AI, fueled by predictive analytics, to predict future wellness outcomes, allowing early crisis interventions.
AI-curated support groups is a 2-level AI agent implementation to nurture support groups for the students. The central AI agent identifies the currently lacking wellness dimension and redirects the students towards the lacking wellness dimension support groups. So here we have 9 AI agents that facilitates 9 support groups. In our prototype, we have included the resource library, personalized suggestions, weekly goals, and many more.
Let's look at the market slides. With WellnessU, we are tapping into a $1.65 billion market opportunity within the US universities.
We have received strong endorsements on the need, potential impact, promise of WellnessU by Dr. David Spite, Director of UU Office, Mr. Tom Andriola, VC of IT and Data, and Ms. Suzanne Helbig, Head of Career Pathway. So according to Dr. David Spite, there's only one advisor per 280 students in his office.
Our B2B model strategically partners with campus resource centers. We offer a fixed pricing subscription of $4.99 per month per resource center. We start with UCI as a proof of concept and partner with at least 5 resource centers amongst the 12 and make it a total annual revenue of $30,000. For our early traction phase, we expand within the UC ecosystem, partnering with 10 universities, making it a $300,000 in annual revenue. For our scaling purposes, we partner with 80 universities within California, making it a revenue of $2.4 million annually. Thus, with WellnessU, we envision a world where there will be only one outcome of a student's journey on campus, and that will be the brighter exit on the right, ensuring students and universities' success. Thank you.
All right. Well, the judges have a question for you, WellnessU. Over there, Renee.
I do, thank you. I noticed on the screen where you were playing the video, there was a lot of personal student information. And so I was just wondering about HIPAA and privacy concerns. Is this something that all students opt into or out of? Are they automatically placed into it? And what do you do about privacy? And who sees this information?
Right.
I guess that was 3 questions.
That's all right. So Renee, you got 3. If that's fine. It's proved.
So firstly, the prototype you saw doesn't have real student data. It's a prototype model because we understand the privacy issue. So it's more like a dummy data and a whole proof of concept. But going back to your point, we have partnered with campus resource centers and the data they collect, because all the campus resource centers in silos collect survey data form, and that's within the university servers. So we do not do it on our system. We sell it as a product to them, and that's how it gets regulated. And in future, if we want to make it a service company, we probably feel we would go for the necessary audits and certifications to keep the data privacy in check. Thank you.
All right. Give it up for WellnessU. Excellent. Boom, boom. Put your microphones back. Thank you, Alex. Something's kind of cool. Has anybody heard of UCI Must? It's a data project. It's funded by the Mellon Foundation. Yes, one person, although you obviously don't check your Discord because it's one of your resources. So Richard Aram has been so gracious to share anonymized student data with the teams that want it for them to actually use and play around with. And so even though that was dummy data that you saw, these students have had a chance to get access to some of the best real-time sentiment data from UCI that's actually being worked on. I'm stalling for you. You come up here. This is good. Plug it directly into the HDMI, and then the dongle's going to be here. All right, judges doing good. Well, they have 3 more. And Steph is doing an amazing job of adding everything up. So in the deliberations, you're going to be able to look and see the top candidates and have any discussion around it, but it's going to make for a quick deliberation. And I think technically we're right on time because we started a little bit late. So again, we have 3 more 5-minute pitches. Stay with us. Keep your attention and your energy high. These students' lives depend on it. Not really, but it probably feels like it, right? All right, set the tone, shiny shoes, and go up a little bit. Good. Is that working there? All right. Jazzy jazz. Oh, actually, Alex, do you need to switch it on your side? Because they're going from their laptop now. Okay. Give it up for Alex, the man, the myth, the legend. And a round of applause for BioApplied Innovation Cove for letting us use this amazing space. If you like it, clap. Yes. It's not every day you get to use a facility like this in a situation like this with so many amazing people who are paying attention with their time because we value all of your time. Get up there, buddy. Front and center. Scoot up a little bit. Make them know that you're not afraid. All right. Yes. Don't touch the buttons. Let them be green. Let them be green.
Testing. Oh.
Yep.
Testing, testing.
Yes.
Hello.
Okay, good. And time. Excellent.
Am I working? I hope it is. All right.
It is. Green, we do a little bump up on the green. All right. One clap together. 3, 2, 1.
Good evening, judges. I know it's been a long night, so I'm going to show you something that I think will all grab some attention. So, in my hand, I've got a crisp $100 bill. But imagine that by the end of the night, inflation had reduced this $100 down to just $30. Now, thankfully, for all our sakes, inflation isn't quite that bad. But I think we can all agree that losing 70% of anything sucks. Well, this is the reality every single day for college students. We forget 70% of lecture material within just 24 hours. And why? Well, we found 3 main reasons. 1, we miss key points when note-taking. 2, our notes are messy and hard to review. And 3, when we do get around to reviewing, we often only do so right before tests. And the result? Students fail their exams and fall behind. And it's not just us that think this. According to Trace Yulee, the director of the Learning and Academic Research Center, who works with thousands of UCI students every year, students are often, quote, overwhelmed by the volume of information they receive. So that's why we're building Notive, the note-taking app that helps students remember what they learned.
Let's take a look at how Notive attempts to solve this problem. So for tonight, we've built a special demo that simulates a student's live experience in a lecture environment. In the center of the screen, you'll see a representation of a student taking notes while a lecture happens. When the lecture begins, the student can click the Start Listening button in the bottom right, and Notive will begin taking a transcript of the lecture in the background. While the student's taking notes, Notive continuously compares the student notes against this lecture transcript to catch when the student misses key points. Look on the left-hand side, and you'll see Notive prompts the student to add this missed key point to their notes. After the lecture, they can visit the Review tab, where they can transform their messy and disorganized notes into a clean and easily digestible format. Long after the lecture has ended, they can use Notive's suite of AI-powered study tools to help them prepare for exams, including one of our flagship features, Mobile Notive, which serves to encourage active recollection by sending students push notifications that prompt them to revisit their notes to answer thought-provoking questions. Additionally, Notive generates flashcards with a glossary of terms and definitions from their notes, as well as building practice quizzes to help them study and prepare for exams. This multifaceted approach to learning and note-taking will help students beat that 70% forgotten curve and crush their exams. That concludes our demo.
Yeah, you can clap. It's okay. Nobody's stopping you.
We're really excited about what we've built, but we're even more excited about the community feedback we've gotten for our product. In a survey of over 100 students, 87% said they love Notive, and 84% would strongly recommend it to a friend. And no matter how students are used to taking notes, Notive is easy to adopt. You can scan your handwritten notes, write them on tablet touchscreens, or use live lecture features on laptops. Comparing to conventional note-taking alternatives, Notive sets itself apart by sitting at the unique intersection of education and artificial intelligence. Currently, we use cutting-edge technologies like OpenAI's Whisper, Anthropic's Claude, and Amazon Web Services. While moving forward, we aim to use prize money to develop our own proprietary model that aims to identify how well a student's notes cover the key points in a lecture. Further, we're committed to maintaining accessibility and data privacy for all of our users. That's why we're targeting key compliances like ADA and CCPA to ensure we're meeting these critical goals.
Ladies and gentlemen, our pricing strategy is organized into 3 tiers. A basic tier for free users with limited lecture length, a premium tier with additional features and unlimited usage, and an enterprise tier for institutions that wish to structurally enhance student performance. Now, based on our extensive market research, we believe that we see a potential revenue opportunity of about $68 million. And that's just the initial target market. We plan to eventually expand to international and K-12 learning spaces. Now, to reach these revenue goals, we've designed a very foolproof and comprehensive go-to-market strategy. Now, the way we do that is first through students. We want to create a radical social media marketing campaign, partner up with student organizations like the LARC and ASUCI, and then also parallelly patent our proprietary models to ensure it's fully foolproof. And then finally, we want to expand our reach and build partnerships with universities across the United States, and then we start at UCI. All of this put together, we believe, will help us reach our goal of getting 100,000 monthly active users by the end of this year. We also wish to partner with learning management systems like Canvas and Blackboard to increase our market presence. Now, here's why we think we are the perfect team to build this product.
Hi, I'm Kevin, and I'm a student developer at ICA Student Council.
Hi, I'm Spike, and I'm a software engineer at an AI startup.
Hello, I'm Sahas. I'm the head of program development at Empower India.
Hi, I'm Steven, and I'm a machine learning researcher at UCI's Share Lab.
We've built successful products in artificial intelligence technology and student experience. And we believe we're going to do the same with Notive, the note-taking app that helps students remember what they learned. Thank you.
All right, don't move, you're moving, get back. I know you feel good right now, but plan it up. There we go, questions. Yes, sir.
So hi, I'm David Spinelli with Microsoft. Have you thought about, instead of building all the AI infrastructure and the note-taking capability, have you thought about using existing products like OneNote and Copilot for Microsoft, and then building the student experiential aspects and the specific capabilities for the students on top of those platforms? Because that would accelerate your go-to-market.
Yeah, so that's a great question. We were looking at existing models as much as possible, and our prototype actually utilizes OpenAI's Whisper, Anthropic's Claude, and Amazon Web Services. But one of the things that really sets us apart is that real-time transcription element, or the real-time lecture environment, which is specific to a student center. So our aim is to avoid some of the hallucinations and build a stronger model that focuses just on unifying this, so that rather than splitting the transcription and the processing across 2 separate steps, we'd be building a custom open source, not open source, sorry, a custom AI model that can do all of that in one. And this would also help us cut down our costs, which we'd be spending on API calls for those existing services.
All right. Excellent work, gentlemen. Excellent, 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 excellent. All right, let's get Cor Sanity up here. Cor Sanity. Judges, make sure that you wrote the name of Notive as you're taking notes. And sorry, but you're not able to use Notive and the notes for Notive. I wonder if there's a judging application for Notive, capturing what they say based on a rubric that you can sort of figure out. Yes. Jazzy AI. It's getting on a Friday night. Student experience, it's so right. Are you curious, Auntie? All right. Oh, nice end there. Let's end it after this final crescendo there. Yes. It's blinking. That means, do you have And you don't have an HDMI. Let's see. No. Alex is here to save the day. All right, we're dongleizing it. Taking notes for the next time I need to save the day. You know what's funny about these teams? You support them with workshops and with resources and Discord. Some of them, they're at your door every day. They're connected with mentors. They're doing it. Others, you don't see them or hear from them, and then they show up. And I think it really sort of speaks to how everybody approaches this whole entrepreneurship thing differently. And you don't have to always have somebody else tell you what to do. Part of the process is going out there and trying to figure it out. But then, once you figure it out and you think you've got it, you realize that other people can help you out. And so what I want to encourage all teams is however well you think you did, you can all do better. And so just be open to finding people with more experience as you build it. But I want you to know getting experience on your own is totally cool. And look at this color coordination, speaking of cool. Ladies and gentlemen, I feel like with the music, we're almost done here. Let's do a nice golf clap, something soft. Something soft, yeah, that's good. All right, on the count of 3, you start, 2 start, 1 start.
Ladies and gentlemen, welcome to Cor Sanity. We all know college is about the skills and experiences you gain to prepare you for your future career. But oftentimes, before you know it, you've graduated with no game plan and even regretting your choice of major. But don't you worry, we're here to transform your college experience and present you with everything you need to succeed. From the moment you step onto campus until you graduate, Cor Sanity will be your intelligent advisor, helping you find the best career path, courses, clubs, and internships tailored specifically to your personality and academic persona using AI technology. Furthermore, by recording your progress and building your professional portfolio as you go, Cor Sanity will become the go-to platform for corporate recruiters looking for young and bright interns like you. My name is Tina Roshania, a quantitative economics major with a burning passion for helping students succeed.
My name is Nima Jafari, and this is Ayush Mishra. We're both computer science majors specializing in intelligent systems.
And together, we'll make sure to, we'll ensure Cor Sanity revolutionizes career planning into a smarter, faster, and easier experience than ever before.
Now suppose Nima here is actually a college freshman named Alex. One day, as Alex scrolls through his emails, he comes upon an intriguing message that reads, "Welcome to the future of academia using AI." He clicks on the link, unaware that it will change his life forever. Here was Alex's experience.
First, he'll select his level of education. Then, he'll fill in his school, his major, as well as his minor if he has one. Cor Sanity uses this information to gather the general education and major requirements for Alex. He'll then check off all of the courses he's already completed. And by logging in, you'll be able to skip these steps and simply update your progress instead.
Our platform then asks Alex what he would like help with today. Being a lost and confused freshman, he decides to seek more personalized assistance using Cor Sanity's AI-powered academic advisor.
Now we get personal and actionable. Alex begins to share everything, from his academic interests, challenges, and experiences, to his personality, work style, and future aspirations.
The very last question of our survey asks Alex whether he would like to share his personal data with potential recruiters that leverage our platform. Student data privacy is of the utmost importance for us at Cor Sanity. Students who choose to share their data can opt out at any time.
And in just a few moments, Cor Sanity will present Alex with our top 3 career choices according to our AI algorithms.
By clicking on any of these choices, he's met with the job description, required skills, estimated salary, and potential demand for the career 4 to 6 years down the line.
Now it's time to plan. After seeing how many credits he's completed and how many he has remaining, Cor Sanity will ask Alex the last few set of questions, including his minimum and maximum units per quarter, his estimated graduation date, his commute time, his class preferences, and more to ensure a plan that fits seamlessly with Alex's schedule.
And in just a few moments, not only is Alex provided with his optimal class schedule, but our AI algorithms present him with customized opportunities in clubs, internships, and jobs in his area, as well as resources like award-winning books, forums, websites, and servers connecting him to communities of like-minded individuals.
Cor Sanity's last page includes a comprehensive preview of Alex's academic timeline, and it gives him access to Corsi, Cor Sanity's AI-powered virtual advisor.
Cor Sanity finds it and puts it all together so you don't have to, optimizing your time, restoring your sanity, and guiding you towards success.
So, how does it all work? Cor Sanity will operate by using openly accessible sources, such as university catalogs, academic websites, and program requirements, avoiding any concerns related to data collection.
Here at Cor Sanity, we're confident that our product isn't only going to be in demand, but it's also going to be an indispensable resource to both students and corporations alike. Our go-to-market strategy will start with university systems and corporations right here in Southern California, eventually moving to Northern California, then going out of state to places like Boston and Texas.
Our most pivotal revenue model involves partnering with large corporations seeking interns and future employees. Utilizing our extensive data, Cor Sanity will market and deliver a curated list of high-performing students to these businesses. Unlike competitors like Handshake, we're committed to offering our more valuable data at half the price.
And of course, we'll partner with college advertising agencies, further increasing our organic revenue growth. But that's not all. We're planning on leveraging our rich student data to create an easy-to-use tool that'll help you make your professional resume in seconds.
Today, we stand at the precipice of a transformative era in the academic realm using AI. Cor Sanity isn't just a platform. It's a gateway to unlocking your fullest potential, optimizing your college experience, and finding employment opportunities that are right for you. So, let's embark on this path of limitless possibilities together. This is Cor Sanity. Thank you.
All right. I'd tell you not to move, but you haven't moved an inch. You're ready. Here's the second to last question of the night. Burning questions. They're putting their hands on their faces. They're thinking. Okay, here we go.
I have one. That's a great presentation, by the way. What do you guys do that's different than what the competitors do? You mentioned price was a differentiation. Are you guys different? Are there competitors that already do this?
So, based on our market research, we haven't found a single competitor that does what we do for students. We take into account their previous academic successes, their personality, and their future aspirations to give them the perfect career path for them. And we also use their user feedback to constantly improve our platform. So, I don't think we have much competition.
Is that all? It is all. You're out of here. Good job. Will you strike the table with you as you go? All right. Excellent work. And it is work. But entrepreneurship is not necessarily your normal 9 to 5. It's like live, breathe every day. Sometimes you think you're going to die. But it's a lonely world until you're surrounded by other entrepreneurs and mentors and people who care about you. And one of the things I'm most proud of that we've done at the Entrepreneur Center is build community. And even though we are competing here tonight, we're one big love family because we're all falling on our face together. And when we see somebody do bad, we're excited to help them. And when we do bad, we know somebody else is there to help us out. We're not looking for unicorns, we're looking for people to start and continue and grow. Try 5,000 times, become the best employee you can, and watch your startup grow. Yeah! Thank you, Steph. Oh, look at this music. I know why this is royalty free. It's because nobody would buy it. It's true. This would definitely not be on my top playlist. But we're live streaming. Everybody say hi to the live streamers. How many people want to guess how many, I checked like 10 minutes ago, how many viewers we've had so far today? Granted, we have 163 subscribers. Not impressive, but my mom said you just need one to get going. Hi, Mom. She's actually watching. Love you guys. She is. 222 when I looked last. with 222 live views on this. So, you know, it's not just about what we see here today, it's about some of those 122. And of the 122, if you see something, say something, and contact us, and we'll get you in touch with these students. Are y'all ready? Scoot up a little bit. Say again? Let's see. Last one to have some tech challenges. All right, we got it. All right. Get into your spot. Get into your spot. Get into your spot. Now, I want all of the students to put your hands together. Put your fork down. Clap for the audience who's been here this whole time. Clap for the judges. You can clap for them as well. Yeah. We did it. Chancellor Gilman whispered something in somebody's ear, and somebody came to us and said, we need to do something with AI, and here we are after fall quarter launch, week 2 in actual winter quarter, and think of all that's happened. Hundreds of students meeting, 85 teams, 61 semifinalists, 16 finalists, and here we are. This is the last pitch, but it's the beginning of the rest of your life. Some are going to win, some are going to lose. Future is up to you. The screen just went black. And we're back. Let's try this. Are you ready? The screen is getting black again.
Hello? Hello? Oh.
But it's going black again. What do we think? Try a different port. Well, we're only in 2 ports. Port. You know what? It's Friday then, it's Saturday, Sunday. What? We're almost there, everybody. And Monday's a holiday. Actually, what's more important about the holiday is the reason why we're celebrating. Give it up for MLK. It's doing some sort of... All right, I don't know if I have any more material to stall. Let's see. What do we think? How about I just hold this up? No, I'm just kidding. Do we have an idea of, do we have another clicker? Maybe the clicker's dead. Maybe all the other teams killed it. It's a dragon. Well, we're just going to try a new clicker here real quick. This is just the drama. Uh-oh, judges. Okay, let's try this. Here. Say, continue. Hit out. All right, this is going to work. It's a clicker issue. We've officially killed the Logitech Mini Pro. Logitech Spotlight. I was thinking of our A10. All right, scoot up. You ready? Yeah, you got a microphone. That's good. All right. Now, not just for the sake of them, but for the sake of everyone, let's give a round of applause. Get this going. Forget about the tech issues. It's going to work. This is the first day of the rest of your lives. On your mark, get set, go.
Hello. We are so grateful for the opportunity to present to all of you. I'm Kaya Shah, a third-year cognitive science major at UCI.
I'm Isha Mavani, a UCI business admin alumni.
I'm Suhani Vasoya, a second-year cog sci major advisor.
I'm Talika Basu, a third-year cognitive science major. My team and I are super excited to present to you today Study Buddy, a learning platform which aims to include every student and learning type in the journey to academic success. Today, we're going to visit the problem, how Study Buddy plays a part in solving it, our developmental process, our long-term goals, and our projected marketing strategy and revenue strategy.
Picture this. It is the night before a major exam. You're overwhelmed by assignments and study guides. You're procrastinating and time is slipping away. Does this sound familiar? This is the reality for countless of college students. But now for a portion of those students, there's an added challenge in answering the big question of where do I start due to their learning disability.
Absolutely, Kea. Of the 75.2 million students in America, 1 in 5 of them have learning and attention issues.
And that's why we're excited to introduce Study Buddy, everyone's personal study assistant. Input your assignments, exams, and study guides and due dates, and let Study Buddy take the wheel. Our AI-powered friend will craft your personalized study plan, transforming your daily to-dos into daily to-dos. So what's so special about Study Buddy? Users can either manually input course information and due dates, or Study Buddy can quickly scan your PDFs and syllabuses.
With our site, you have the flexibility to ask the AI for precisely what you need, whether that is a study plan for an upcoming midterm or creating a quarterly schedule. Study Buddy is more than just a planner, it's your personal study guide.
Another strength of Study Buddy lies in its adaptability. With the help of AI APIs such as Galactica and GPT, Study Buddy is able to produce practice tests in order to see your performance based on your course information, and therefore will adapt your learning plan based on your performance.
And when life gets busy, we got your back. Our site sends reminders on how often you should be studying daily or weekly to meet your goals, and those goals can be adjusted to your needs.
Here are a few sample learning plans backed by cognitive science research. These specific ones are tailored to learning disabilities such as ADHD, dyslexia, and dyscalculia.
So, you might be wondering what sets us apart from other competitors in the market. Well, at Study Buddy, we merge cognitive science with neuropsychological profiles of every student, and we take into consideration the needs of students from across the learning spectrum. And we ultimately create unique, personalized study plans that is catered to each and every student. Moreover, we also promote mental health. We do this by promoting stress management and a healthy work-life balance.
Here we have our projected development process. We will begin by surveying a large group of people with different learning backgrounds. We will pair this diverse data set with the use of tools like PyTorch and TensorFlow in order to increase our algorithm's accuracy. After launch, we will continue to collect user feedback in order to make this experience cater to you.
The estimated timeline for this process with the right team and resources is 24 to 36 months. We are currently in the initial planning and research stage and are actively seeking participants, individuals with expertise in front and back end developing, UI and UX design, AI specializations, and marketing to build our dream team.
We are super excited about the growth of Study Buddy. We plan to partner with in-person tutoring agencies like Kumon and hopefully integrate them into an online education platform. Moreover, our biggest goal is to work with learning management systems like Canvas and hopefully use Study Buddy as a widget or extension.
Now, as for our marketing strategy, let's take it back to the basics: ethos, pathos, and logos. Our app needs credibility and data from experts in the fields to add value to our product and to gain our users' trust. Implementing student and teacher ambassador programs is a great word to mouth as they add a more personal experience to our product. Our main source of revenue is a subscription model. There's Study Buddy Basic and Study Buddy Pro, ranging from basic to unlimited app access. Study Buddy Pro will be presented in both monthly and yearly plans.
The future of Study Buddy is exciting. We're here to elevate your study experience. We're not just here to follow trends, we're here to set a new standard for what study tools can achieve.
So are you ready to experience the transformative power of Study Buddy? Choose our platform for a stress-free and effective studying experience. Your success is just a click away. Let Study Buddy be your guide on the journey to academic excellence.
Thank you.
Thank you, guys.
Thank you.
All right. Way to fight through the real-time tech challenges. Take 3 steps forward proudly. Boom, boom, boom. Judges, do you have any questions? Yes.
how are you assessing the impact on each student? For instance, you talked about kind of the learning models that they need, or telling them how much they need to study each week. How are you determining those hours?
Through our initial launch, we hope to collect a lot of user feedback so that we can continue to refine our model through the user feedback. And so that's how we first want to measure our impact. And then we will continue to measure impact by constant, there's like an ability for them to write survey how well their plan is working for them throughout their continual use of the platform.
And to add to that, the neuropsychological profiles are based on measures like memory, IQ, problem-solving skills. So over time, our AR algorithm hopefully is able to see improvement in those areas as well.
All right, round of applause! It is now officially sealed. It has happened. The $51,000 in checks are gone. Big round of applause for the judges. And no offense, judges, but more importantly, all the students. And for the Entrepreneur Center team who put this damn thing on and pulled across the finish line through all the challenges, through shorthanded, through staff changes, through regular job duties. My goodness gracious, I'm proud of our team. Judges, would you please stand and follow Thomas Andriola, Vice Chancellor, Data Information Technology. You're going to Paradise Cove, where you will deliberate, and we will see you back in likely less than 10 minutes because Steph is so organized. Alex, if we can get something that's not jazzy smooth, but jazzy fresh, get a chance to sort of commingle, organize, maybe talk with the teams. Once the judges come back, we will be deliberating the final thing. Ready? I gotta stop talking, Alex. Hit me with some jizzy jazz. That's good. That's jazzy. I like it. And all of our YouTube streamers out there, thank you. Michael Houlihan, Bonnie, Harvey, I see it. Mom, Dad, everyone on LinkedIn. Stay tuned because we'll be back announcing live the $51,000 in change. And shout out to Austin, who's been our cameraman the whole time. Give him some shout outs. Yeah, Austin. Woo! All right. And then Elvin K over here. It hasn't been publicly announced yet, but this man is a huge part of the growth that we are seeing because alumni want to come back and come to give back. Round of applause for Elvin here. 100,000 applauses, by the way. Let's give it up for this man for supporting us. Yes, sir. And if you check all of our social feeds, there's a recent interview where I interviewed him and he just drops all kinds of great advice. All right. Teams, get your photos, get organized, be anxious and stressed. There's nothing for you to do now. Yes, sir. I will disclose all the judges' LinkedIns to you on Discord. That way you can all follow up and thank them first, share some of their content, make meaningful, thoughtful content, and then ask them for what you want. I need to stop talking. Oh, Alex, can we drop the jazz music just a little bit? Just a little, yeah, there we go. This is a good chance to meet somebody. If you saw somebody with a great presentation, let them know. And hey, Alex, can we do it to like, I think a few more to where it's like the award ceremony? There we go. I just peeked into the judges' room, and they were like, they're debating. There's a lot of discussion going on. So I told them, short time, short time. And they're like, and I said, okay, make everybody win, and you all just give more money. And they're like, ah, ha, ha, ha. We'll be right back. So they're discussing. So, a couple things. I'll speak a little bit over the music till Alex gets back. There's a survey. We'd love for you to take it. It just helps us document how impactful this was for you, and that helps us get more sponsorships going. So if you truly can, just give your honest answers. That'd be super helpful. If anybody wants another stage to practice pitching on, have you heard of 1 million cups? Cynthia, you want to come talk about 1 million cups? All right. Cynthia Kirby, everybody. Give her a little round of applause. Not too aggressive, not too aggressive. All right, 1 million cups actually started in 2014, and the Entrepreneur Center was part of that catalyst that started it, and it just continued. Here you go.
And practicing their pitches, and to assist you with helping with other problems that you may be having in your business. So we meet every week, Wednesday mornings from 8 to 9. The Irvine group has been meeting online since the pandemic. We meet once a month in a hybrid situation, so we meet in person as well as online once a month. You can pop in, see other people pitching, give them feedback on how they're doing. You can come in and pitch yourself, and it's a really good place to get practice. We have people that come in repeatedly and do their pitches, and we see how their company evolves over time. So you can find us on Meetup, and if you go to 1 Million Cups, their website, you go to the Irvine version. And we also have like overtime in our group, so we go 8 to 9 and then 9 to 10. So please join us.
I'll make sure it's in the Discord. Everybody get up for Cynthia Kirby running 1 million cups. 1 million cups, the Kauffman Foundation came up with this concept. If you put entrepreneurs together and they sort of talk over 1 million cups of coffee, like the world could change. And it's a supportive environment where you get to pitch, and then you get supportive feedback, like everybody's a judge, and it's a networking event because when you ask a question, people get to know who you are, and then it's a really great community. One of the best ways to get better at pitching is to watch people pitch, is to give feedback, because the best way to learn is to teach. And so as you look for other opportunities, what are some other opportunities post this competition? Where can you go? What's another competition on campus? New venture competition, Stella Zhang new venture competition. What else? If you have something that's designed, Beal Butterworth competition. How many people are going to take their ideas and move forward into those competitions at least? Awesome. Go win it. James Dyson has a competition. There is a Holt Prize competition. There are so many competitions. So honestly, if you lose tonight, because some of you will, I'm sorry, right? Some of you are going to win, some of you are going to learn. And so take those learnings and move forward, because this is just the start. All we want you to do is start, and we want to help you continue as far as possible. Make sure to take the survey so we know we get the date and go back. The judges are here. Give them a little round of applause. They're going to give you money. And Steph, do you have a vision of how this should play out?
The designated judge for each track will announce third, second, first, and flip, or whatever order they decide.
Okay. All right. So, Alex, can we go back to our queued program? And can I get the AI Health Impact representative judge up here? All right. David from Microsoft, give him a round of applause. Microsoft does a lot of cool stuff in health, And it's exciting of how front edge they are and that they're so involved with the center now and forever.
Hi, I'm David Spinelli. I am actually with Microsoft Worldwide Health. I'm a digital strategist there for Microsoft. Since I'm the first one going, I don't know how we're doing this, so you're gonna have to help me.
Ooh,
I've never
that's a
done
heavy
something.
check. That's 200, oh no, not 200,000, that's 20. Maybe next year, looking for sponsors.
No, can I go to Fashion Island?
I don't know, Microsoft gave $10 billion to OpenAI, why can't you give, anyways.
So I've never done an award like this before, so I'm gonna not improvise. So I'm just gonna
But
announce.
say a little bit something about this, the what did you think about the track? Oh, don't turn!
I'm not turning.
Gosh, you're gonna give me a heart attack.
No, it was absolutely amazing. Microsoft does Imagine Cup, which is a worldwide thing that.
Oh my gosh, yes, Imagine Cup. And we had our students place 3rd last year, by the way.
No, they did, well, kind of yes and no. They did better than that.
Oh.
So Imagine Cup, the final presentations are done in front of several thousand people at Microsoft's internal conference in front of Satya Nadella, our CEO. And the overall global winner gets to have dinner with Bill Gates. And I think it's like 100,000, I think the number is. Renee, would you know the number? No, I think it's 100,000 they win. The team here from UCI was the North American champion.
Yeah, Chidru, Lakshmi.
And so.
Edgeburg Center, represent.
Absolutely amazing. It was on tuberculosis, very similar to what was done here with a device where through low voltage Bluetooth, I believe they did it to the phone upwards. So, yes, so we're going to get out of here, so we'll stop babbling. So, 3rd place.
Drum roll. Oh, sorry.
Great
I didn't know if you were
presentation is.
Drum roll!
AI
Scan! Woo! 2,000 bones. All right, Angie's our photographer on duty. Give it up for Angie, our social media coordinator extraordinaire. Woo! All right, and we'll have you stay up there. Good. Cheat to that side. That's good. That's good. Angie will tell you what to do. Oh, they just keep walking. They're following you. Stop. They're chasing. This is not your checks. Stop right there. There you go. Oh, all the way this way. Come on down. Steph says come down this way. That's good. You don't turn around, sir.
I'm not
Wash
turning
up.
it around.
All right, there you go. Everybody say smile. All right, round of applause. Nice. You can scoot down here, scoot down here. Don't get cut off. You can go like right there. All right, come behind them. Don't let anyone see you. All right, back to you, David.
So in 2nd place, and I did love this one a lot, is Kido Care.
All right, Kido Care, get up there. Ooh, people are getting nervous now. It's either good news or bad news for your team. I don't know. I'm getting nervous. All right, listen to Angie. Go about mid-stage. I say listen to Angie, and then I say something. It doesn't make sense. All right, she's going to do that. Everyone in the audience, say cheese on the count of 3. 1, 2, 3. Oh, perfect. All right, another round of applause. Nice. All right, and Alec, change the back slide. Look at this. The big winner is, yeah.
For 5, as we say.
10.
No, hold on. As we say in Jersey, for 10,000 Somalias. Move AI.
They got their own startup t-shirts too. Go figure. Woo!
Congratulations.
All right, get center stage. Oh, keep going. Go over there. Go over there. Go over there. And good. Watch Angie. Audience, everybody say, "Move AI" on the count of 3, and say it with a smile. 1, 2, 3. Move AI. All right, we can hear those smiles. And all right. Okay, stand back. So you got back, and the other teams, we want you up there on stage right now. Let's go. The other teams that competed in this track. Come on, give them a round of applause. Let's go. Let's get everybody up on stage. The fact is, everybody's a winner. They got here. It's just some people got an added bonus. And watch this. People are coming up on stage. Come on, just get lined up. Get shoulder to shoulder, just get a good shot. Give them a round of applause. Look, this is where it starts. Talk to me in 10 years. That's the real winner. You have dinner with Bill Gates and myself, all right? All right. You got this, Angie? Everybody look over here. Photo. Good. Get in there. Big round of applause. The future of medicine is here. And of course, we're going to do a stage selfie like this. Ready, set, go. All right. Round of applause. All of you get out of here. Good job. Next three. All right, Alec, if we can go to the next slide, please. Alex, I'm sorry. Oh, yeah, these are for you. And I would like to say, you know, first we had the innovation challenge for mental health. Then we had it for sustainability. And you know what? These checks are expensive to print and the boards. But does anybody know about UROP, Undergraduate Research Opportunities Program? They do their poster presentations. But that poster is not, you don't get a poster 9x16. These are what they chop off the top, and they're just going to be wasted. So we use the excess of the chopped research papers that students use, and that's why we get a discount, because we try to do everything sustainable. And Maya, where's she at? Our sustainable. All right, let's go. Who's a representative on the judge for this next track? Stuart! This is it, Stuart! All right, give it up for Stuart!
Don't touch the buttons. Okay, storytelling. This is the focus of my life here at Beal, so I'm really excited about this. All of you guys are winners, like Ryan said. And we have this program for those that are here called iCore that you can go through. It's all about doing customer discovery and figuring out how you're going to take your product to the next level. So all of these teams, please get in contact, and we'll get you into an iCore class so that you can get your product and your company launched, right? So there you go.
Woo! And actually, you know what? With iCore, you get reimbursable funds to go and find customers.
Up to $5,000.
Up to $5,000, whether you won this or not. So why not get out there and discover thanks to BAI? Round of applause for a Beal Applied Innovation.
Okay, in third place, we have Overshoot.
Whoa! Nice, nice, nice. You got to clap till they get to the stage. I know you're tired, but that's okay. All right, you can stop now. They got there. That's good. Appreciate it. All right, listen to Angie as I go. Right in the middle there. All right, on the count of three, you're going to say moonshot, audience, because they said they're not a moonshot, but we're going to make them smile. Say moonshot on the count of three. 1, 2, 3. Moonshot. All right. $2,000 to move forward in your journey.
Congratulations. In second place, there's a large market for small businesses.
Whoa!
Vango.
SCP.
I love the excitement.
Woo!
Yeah.
Get up there. Get a hustle on up there. Get up there and be walking all slow. All right, all right. There we go. Get in the middle. Get your photo. Get your photo first. Get your photo first. All right, and then on the count of three, you say the first word that comes to mind when you think of social media. 1, 2, 3. All right, thank you for the 3 people who participated. Give them a round of applause. Excellent. Now, wait a minute. There we go. Got the right slide?
Okay, we're really excited about this. The judges, we all talked, there's some excitement in the room for what could happen productizing and doing things.
Did you say judges or investors? Because maybe, who knows?
There was honestly a little bit of like, hey, you know.
So this is a $10,000 plus prize right here, everybody.
Plus the $5,000 for iCore, right? Vision board.
Yeah! The dragon is real! The dragon is real! Woo-hoo!
Congratulations.
Yeah, buddy. Stuart, we need to take a picture with him. Let's go. Let's get a vision board sandwich right here. Yes, sir. Yeah. Yeah, buddy. Congratulations. This dude is always around. He's always hanging out. He's always talking with people. He's engaged, and it showed. Awesome, awesome work. All right, Angie, you want to get your full photo there with everybody? All right. Very cool. Everybody, don't clap, just go, yay! All right, don't move, don't move. We got to do a little ginger selfie here on the count of uno, dos. The other teams, I'm sorry, yes, please. Would the other teams get up here because you are also winners? You might not have a check, but let's get up on there. Let's go. Come on, come on. In my haste of moving fast, I apologize for missing that. I will delete that group selfie photo. This is legitimate. You got to clap till they get the stage. I promise you're almost done, I promise. Scoot, 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 like a bunch of ants. All right. Angie selfie, ginger selfie. Here we go. 1, 2, 3. Nice, we nailed it. Congratulations. And guess what? Your teams can move. You can attract, you can find more people. You can move forward. Also, judges, I'm going to give everybody your LinkedIn. They're going to like you and like your content, participate, but they might reach out to you as well. The AI and Students Experience, who's our representative? All right, here you go.
Hi, everyone. I am so pleased to give this award out. I am the Associate Dean in the Graduate Division, and my entire job is to make lives better for grad students. And so I talk to companies that do this kind of stuff all the time, and there were some incredible presentations from all of you. Great pitches. Which one's one? That's third.
That's number
fabulous.
3.
I'm going to stay with that order. Okay. So.
Oh, whoa, don't turn, don't turn.
I'm not turning, don't
okay.
worry. Okay, third, with a great pitch for something that is incredibly needed at every university right now, for Wellness U.
Yeah! Woo! Money on the table, big prize.
This is an exciting thing because, as many of us know, students have not recovered yet. Come on up here. From there you go.
You stand in the middle.
Okay,
this is
I'll
good.
stand here.
Students have not recovered from a pandemic.
From the pandemic and all of the mental health.
Well, you smile real quick. We'll talk about it. The pandemic sucked, but we will fix it.
Yes,
Here we go.
Great
nice.
idea.
Good job. Good job.
Okay, second. So, this is, again, another pitch that is highly needed for students to kind of help organize their life and get them on track. And for second place, it is Cor Sanity.
Woo! Oh my gosh, this is going to be fun. $10,000 for first, $5,000 for second, $2,000 for third. Multiply that by 10 because Tom is so excited he wants to 10x our prizes next year. Oh, is that what you said? Oh, never mind.
Awesome, guys. Thank you.
All right, nice. Don't leave, don't leave, don't.
And finally, for first place, this is for a product that we actually have not really seen before.
Ooh.
And it is also for the best matching ties.
Oh.
Congratulations.
Money ties. All right, let's get the rest. Let's get the rest of the student experience track up here. Let's go. Let's go. Come on. We still love your vertical websites. And watch out for these two dudes. They're going to sign up for iCore immediately, and they're going to crush everything as well. Look, this is just the start.
And I would love any of the groups that are doing stuff for student services to come talk to me. Since I deal with these vendors all the time, I have thoughts for each and every one of you. So any of you, please contact me. Thank you.
All right, excellent. Round of applause. Get up there, be proud. All right, Angie's gonna do hers, I'm gonna do mine. All right, ginger selfie going this way. Looking here. Uno, dos. Wow, look at that line of checks. Here we go. Trace. Nice. Wait, did you want yours? All right. Everybody, just clap. This is it. This is it. Your Friday night is here. All right. Well, hey, thank you to the sponsors. Thank you for the alumni who helped to support. Thank you for everything. Thank you for Steph. The top winning health impact, we have gifts for you. Listen, if you competed and you want to get a group photo, let's do a big group photo. You guys don't have to leave. That's fine. Everybody else, you can leave if you want. Congratulations, everybody. It's all about starting. Give it up for the judges! Nobody throw away their cups because we recycle those. Let's go, everybody get up here. In fact, you know what? If you're even an audience, get up here if you want to be part of this. We're going to get a big photo and then you get to go. Let's go, Tom Andriola, Shanad. Let's go, Miriam, you can't leave without a photo. Let's go. Everybody squish on the stage. Come on, let's go.
Please don't forget to throw away your trash. I want to go home too. Thank you.
All right, let's go. Just get up on the stage. Stuart, get up there. Get up on the stage. You're getting up on the stage. It's a big photo. Let's go. Audience too. Why not? Let's just go around. Make it this way. Actually. Yeah. Are we trying to do this still? Or are we over it? All right, let's do it. Real quick. Tom's in there. We're in there. Let's go. You might have to scoot way back. Get the checks. Get behind the checks. All right, get in the picture in 10 seconds if you want to. 9 seconds if you want to. 8, 6, 5, 4, 3. So many people we can't even get them. 2. Cheese. Over there. All right, and then look this way. We got a big one going this way. I got you all. 1, 2, 3. Vertical for the gram. That's it, everybody. It's a wrap. Thank you. Come to our programming. Come to our workshops. Come to our Wellness Wednesday. Be engaged. Build community. And for God's sake, solve problems. This is Ginger MC. I'm going to home, and I'm going to bed. And let's say your hellos and goodbyes and get out of here because we're past our time. Thank you, Bill Applied Innovation. Chrissy, I appreciate you. Alex, you're the best. We love you all.